morning and welcome to the World Health Congress of 2023. We are very glad you have decided to join us here in hall number 2, whether you're here in person or online. And now, without further ado, let me welcome our first guest, who is Professor Dr. Karl W. Krátký, who will be joining us online. Can you hear us, Doctor?
Yes, it's okay.
Please, your presentation.
Yes, I do. Good morning, dear colleagues. I will speak about the relationship between orthodox and complementary medicine and how it is changing now. A short historical sketch about the traditional medicine systems over the thousands of years. The European origin is due to the ancient Greeks, and this later called humoral pathology was transferred in via the Greco-Arab medicine to Asia, to India and Pakistan. It's Unani, which is now still done there, and in the traditional Persian medicine, which is also actual there. In Europe, it was replaced quite late, we will come to that later, by the cellular pathology, and this turned into the orthodox medicine. But since about 2000, there's a revival of the European medicine, which is now called traditional European medicine, and this is an interesting development. The Asian origin, the Chinese and the Indian medicine systems are also about as old as our European system, a little bit more than 2000 years. We have scriptures. And the Tibetan medicine is a little bit different. It is not original, so to speak, but the synthesis of all the other medicine systems. About 1,000 years ago, this was done. In China, there was in the 60s a revival of the Chinese medicine, which was then called traditional Chinese medicine and transferred to Europe and the USA. What is characteristic for complementary medicine systems is a kind of holistic approach that the individual patient is treated. In practice, this transforms a little bit into a small number of types in connection with the elements. We know maybe the Greek 4 temperaments, which are such types. And the treatment of patients is according not just only to their symptoms, but also to their type. This is a book of mine, first in German, then in English, where one can look that up in more detail. Now, what happened in Europe, the early modern period, it was a rise of natural sciences. The success was very large in connection with astronomy, astrophysics, and the natural science really became more and more important. And the question was, is it maybe a new a model for a new kind of Western medicine? Characteristic is the objectivity, universal laws, simplified experiments. One did avoid disturbing influences as much as possible because this was too complex. Reality was too complex, but it was interesting that it was successful anyway, this kind of simplification. So one can say clean science, dirty reality. And about 1850, which is quite late, there was this orthodox or conventional medicine developed called cellular pathology at that time. And I will skip that term. I don't like conventional. I stick to the orthodox medicine as expression. And there you see other terms which are used. Interesting is the physiology and pathology. There are, of course, similarities and differences concerning humans, but the Orthodox medicine has a focus on the similarities, so to speak, a general average human. And the focus of the complementary side was more on focus on differences, individual patients treated. Back to the Orthodox medicine, this so-called evidence-based medicine, this term was created or popular since 1995 and is based on trials with many patients, so to speak. Every patient is a representative of the average patient. There are three components. I just look at my time. Yes. There are three components in evidence-based medicine, which are usually not taken into account. The first is the external clinical evidence from systematic research. We come to that later. But also the experiments of the clinician and the preferences of the patient. All these three components belong to that. But usually only the first component, which fits to the scientific view, is considered. And the gold standard to realize that, to give it into reality, was a placebo-controlled double-blind trials, randomized additionally. And this is the gold standard, or was the gold standard in Orthodox medicine. One has usually one size fits all, or here one drug fits all, corresponding to the average human. The clinical trials use usually just one drug for the patients, and usually it is only patients with one and the same disease are treated. But in practice and in treatment, it's just the other way around. Several medications are often used for a patient, which are also often multimorbid and old. So not just one drug and not just one disease. So again, you see what is the basis of the scientific science, modern science, clean science, dirty reality. This can also be seen in the Orthodox medicine. So the gold standard yields good quality, but for an unrealistic situation. It has, I will skip the adverse effects and so on. That's not so important. Because I will come to the new transformation only 10 years after the invention of the evidence-based medicine, the Orthodox medicine has again changed, or is now changing. And it comes from the Human Genome Project, where one could see that the gene variants, gene defects have to do with risk to get specific diseases. So no longer there was an average human, but everyone has different genes, and so this mindset of Orthodox medicine is changing. There's emerging a new Orthodox medicine, and the level, I will also skip that, is now going from the genotype to the phenotype, not just the genes, but also other things like epigenetics and so on. And this new version of Orthodox medicine has several names. For instance, personalized, stratified precision medicine, or P4 medicine. I will come to that a little bit later, or systems medicine. And the average human is no longer in the center. The personalized medicine or stratified medicine means that, for instance, the patient stratification is important, and also the stratification of diseases. Interestingly enough, in complementary medicine, there is a natural stratification in these types, these human types, which are existent in almost all of these systems. And So this general mindset, new mindset that people are all different between complementary and orthodox medicine means that they come closer. And you see here 4 papers which are quite recent. And you see in the second paper the expression genomics, which is quite can often be found. So there's a bridge between Ayurveda, the Indian system, and genomics. So it is really an interesting development. The P4 medicine, I'm again looking on my watch, okay. P4 medicine, you see here what are these four Ps: predictive, preventive, personalized, and participatory. And you see that the complementary side on the right side is close to this P4 medicine, but far away from the evidence-based medicine up to now. Only the paternalistic way is different from P4 medicine. It is more like the old orthodox medicine. You see here the expression. And the participatory is people have their wearables, they have healthcare apps on their smartphones, and for instance, nutrition and fitness is more and more important. This fits to that new style, so to speak. But there are many data are created by all these variables and so on. And the question is how to handle them. And they are given over to the big tech companies. And so I'm afraid to say that the participatory phase will end soon because the companies will be in charge. In the systems medicine, the importance of connections within the body, which is quite new in orthodox medicine, and this is so relevant. And one example is the so-called oculomics, or sometimes called oculomics, is that the connection with retina and the rest of the body is so tight that one has found by artificial intelligence methods that there are patterns and relationships here and in other cases that are otherwise remain hidden. So if one looks at the retinal image, one sees, for instance, if the people has a cardiovascular disease, is dement, or has a chronic kidney disease, for instance. On the other hand, these artificial intelligence programs are like a black box. It cannot be explained how the programs find the result. To literature, to possibilities to see what the artificial intelligence plays quite some role, more important role. And this is also not far away from complementary medicine. We think of pulse diagnosis. It's very complex, and the physician cannot really explain, but he sees and he feels what is the case with a person. So I think this is something where they both come also closer. And I will skip that. It is some examples what in the artificial intelligence, machine learning, pattern recognition, and the whole big data stuff is coming up. And this is a difference between the complementary and the personalized medicine. In CAM, much collective and individual experiments. It is done over hundreds of years by many people, physicians, and one has to learn, for instance, pulse diagnosis for years or decades. And so this is collective and individual. On the personalized medicine with the big data and artificial intelligence, this is very new. This is very quick, the development. And it is in a way, this is complementary to this CAM way. So this is not the same, but on the other hand, yes, that's my last.
You have 1 minute left, please.
Yeah, that's okay. And the question is, can both sides together? The role of the gold standard has to be reconsidered. it's no gold standard anymore because it does not fit to the new thing. And there is one paper where, for instance, where it is shown, and that the adapting of the RCT for precision medicine. So I hope that there's a good, or I think it's a good chance that the both complementary and orthodox medicine come together. And so in the end, I will ask you if you have questions or comments. You're invited to write me an email to discuss further. Thank you very much.
Thank you very much, Dr. Kratky, for your presentation. And our next guest is a recorded video from Miss Becca Meadows of the United Kingdom.
Good evening. I'm sorry I can't be there in person to present my research, so I hope I can share in the next 10 minutes via this recording a new piece of research conducted by both myself, Rebecca Meadows. I'm a registered nutritional therapist, but also a master's student in nutritional therapy at the University of Worcester. And alongside my supervisor, Miranda Harris, we conducted a systematic review and meta-analysis of observational studies looking at a vegan diet and pregnancy outcomes in both the birth person and the neonate. So why did we conduct this research? Many of you might already be familiar with the fetal origins hypothesis put forward by Barker in the 1980s. This promotes an association with pregnancy diet, not only in the neonate born from that pregnancy, but also in the next generation of offspring, showing that pregnancy diet is particularly important in terms of public health impact and consequences. When you combine that with a 400% increase in the number of 18 to 24-year-olds in the United Kingdom identifying as being vegan, you can see that this is potentially going to be a significant area for public health to be interested in. It then is rather surprising when you look at the National Institute for Health and Care Excellence here in the UK to see that their maternal and child nutrition guidelines don't contain any recommendations or reference to a vegan diet either during pregnancy or in childhood. So after a title and full text screening, we had 6 observational studies which we included in the review and took forward to meta-analysis. And the aim of this study really was to try and advance this gap in understanding and quality of evidence, looking specifically at a vegan diet and pregnancy to support nutritional strategies for not only improving the dietary practice of vegans, so allowing people to make an informed choice, but also perhaps the other way in terms of looking to see if there's possibly any benefit of a vegan diet during pregnancy, and therefore some dietary implications that might be relevant to omnivorous birth persons, not just vegan. So very much looking on both sides there. We did this with 2 key objectives. The first one being evaluating the relationship between a vegan diet and both birth person and neonate health markers during pregnancy. And we'll come on to discuss what markers those were. And then objective 2 was to really take forward the evaluation and hopefully from that be able to propose nutritional strategies for both nutritional therapists, but also wider for healthcare practitioners to support informed dietary choice for those trying to conceive and those who are pregnant. So how did we do it? The methodology. So firstly, we registered the systematic review on Prospero, and then I conducted a search on 3 online databases looking at CINAHL, Medline, and PsycInfo. I then also conducted a systematic search of all non-indexed literature. We conducted title and abstract screening and also full text screening in duplicate against a number of inclusion and exclusion criteria. One of the main inclusion criteria being that it must cover one of our outcomes. So the primary outcome being neonate birth weight, but then also a number of secondary outcomes. In terms of the neonate, we also looked at preterm birth, small for gestational age, gestational length, and then from a birth person perspective, we looked at the risk of maternal anemia, gestational diabetes mellitus, pre-eclampsia, depression, and also pregnancy-induced hypertension. After having conducted the screening and full text screening, we then conducted a risk of bias assessment using Robbins E-quality assessment as outlined in Cochrane Handbook. And effects sizes were then calculated using the standard mean difference method and combined using a random effects model. After this, we conducted I-square tests to look at heterogeneity and also a final grade assessment to determine the strength and certainty of our evidence. So what did we find? The results. There were 6 studies that met the inclusion criteria and were able to be taken forward into meta-analysis. This resulted in a cumulative number of 2,269 neonates, 527 neonates born to vegan birth persons, and 1,742 neonates born to omnivorous birth persons. The only outcome, either neonate or birth person, of which we found a statistically significant relationship was in terms of neonate birth weight. And here we found that there was a reduction of 120 grams in birth weight of neonates born to vegan as opposed to omnivorous birth persons. And you can see there that that's to a 95% confidence interval and with a p-value of 0.03. However, the meta-analysis did have particularly high heterogeneity, an I-squared of 86%, and funnel plot and subgroup analysis were not conducted due to the small number of studies that were able to be taken forward to meta-analysis. There were no statistically significant relationships found with any other neonate markers. So although we did conduct meta-analysis on low birth weight, gestational length, preterm delivery, and small for gestational age, none of these produced a significant relationship. No meta-analysis at all was possible in terms of birth person outcomes, as there was only ever single studies relating to each birth person outcome. Overall, the studies had a high risk of bias, and the grade assessment came out as very low. So what can we take from this? What does this mean for us? As mentioned, the study suggests that there may be a reduced birth weight in babies born to vegan birth persons compared to birth persons eating an omnivorous diet. However, what's really important to make clear is whilst there may be a reduced birth weight, what this study can't do is draw any conclusions over the level of risk that this reduction in birth weight actually presents to the neonate. Also, I think it's really important to highlight the fact that there is insufficient research with single studies only for each outcome to consider the impact of a vegan diet on birth person outcomes. There was insufficient research to be able to come up with anything in terms of the impact on the birth person. So whilst we can't draw any conclusions over the level of risk, the small relationship that we did find in terms of reduced birth weight suggests that some level of education and nutritional therapy support to pregnant vegans could be worthwhile and perhaps an opportunity for more of an integrative approach to obstetric care. From these conclusions, what we wanted to do was try and pull forward a number of suggestions or considerations for the National Institute for Health and Care Excellence here in the UK for their maternal and child nutritional guidelines, which are due to be updated quite soon. And this is recommendations that could be implemented by both nutritional therapists and wider amongst the healthcare provider community. And based on the fact that the relationship that we found was small and with high heterogeneity, the recommendations that we come up with are predominantly non-invasive and are deemed to be low risk and of low cost to implement. So the first recommendation would be to be able to signpost and direct pregnant vegans to standard guidelines on vegan dietary recommendations and considerations during pregnancy, as this currently does not exist in the UK. Secondly, we recommend greater healthcare professional education on vegan diets and common deficiencies caused by excluding animal products. And then thirdly, suggests that more as routine, healthcare professionals consider micronutrient status testing of all vegan birth persons beyond simply iron, which is already tested in the UK, and looking also at serum B12 status, with B12 being one of the other micronutrients, or one of the only micronutrients only available in animal food sources. Future research. Again, we really need to be able to articulate what this reduced birth weight actually means in terms of risk to the neonate. We need better quality, larger scale observational studies, really looking at birth person outcomes, prioritizing hypertensive disorders as the most significant morbidity risk during pregnancy. Thirdly, longitudinal cohort studies looking at the long-term health impact of a vegan diet during pregnancy would help guide public health policy slightly more effectively. I'm sorry I'm not there to answer any questions. If anyone would like to forward any questions through to me, please feel free to get in touch via my email or via my website. And Miranda Harris, my supervisor's email, is also there. The QR code will take you to my poster and my research and provide a DOI. Thank you very much.
Thank you very much, Dr. Becca Meadows. Our next guest, Shri Danada Kulkarni, could not join us, unfortunately. So we will have 15 minutes of alternative program if you would like to go see hall number 1, and we will meet here soon. Thank you. Musical performance. Let us continue with our program. Our next guest, joining us from India, is Miss Nimisha Narendram. Miss Nimisha, can you hear me?
Yes, ma'am. Am I audible?
Yes, you are. Please proceed with your presentation.
Thank you so much. A very good afternoon, ladies and gentlemen, esteemed guests and honored colleagues. I am Dr. K. Nimisha Narendran, final year MD Scholar, Department of Kaya Chikitsa, Government Ayurveda College, Trivandrum, India. Today, I am here to embark on a case presentation which aims to explore the boundless potentials of Ayurveda and its endeavor. I am here to share a case report on Lafora progressive myoclonus epilepsy. So what is Lafora? Is it a rare disease? No, it is an ultra-rare, most fatal autosomal recessive progressive myoclonus epilepsy called PME. Among the PMEs that we have, again, Lafora is unique. Why? Because of a rapid neurological deterioration of the patient with an adolescent onset. This disease is associated with high rates of consanguinity and mutation of two genes, EPM2A and 2B. Because of this genetic mutation, there is absence of two important protein molecules, laforin and malin. These together form a complex structure involved in glycogen synthesis. So in absence of these, the glycogen synthesis is impaired and there is accumulation of the aberrant glycogen molecules in the brain and the spinal cord. Now, this disease is new to me. It may be new to you, but Lafora had been in this globe for more than 110 years. Sir Rodriguez Gonzalo Lafora described the disease in the year 1911. This maestro of neurology, he found the accumulation of aberrant glycogen aggregates in the brain and the spinal cord. He named them as Lafora, which are the hallmark of the disease. Beginning in the late childhood and adolescence, this disease announces itself first by a seizure, followed by an evoked train of myoclonic jerk. Mostly the first symptom is mistaken as a simple epilepsy, and it takes around 9 months to 2 years to arrive at a correct diagnosis of Lafora. The clinical features include tonic-clonic seizures, myoclonic jerks, drop attacks, visual hallucinations. There is a progressive decline in the cognitive ability of the patient. They gradually develop dysphagia, apraxia. They become cachectic and bedfast, succumbing to recurrent infections. They die because of status epilepticus and aspirational pneumonia. This disease kills the patient in a duration of 10 years from the onset of its first symptom, and sadly, most of them do not cross their 25th birthday. Now, Lafora has been declared ultra-rare by an organization so-called NOD, since the prevalence is less than 4 cases per 1 million individual. Majority of the cases reported are from Italy, Spain, and India. Coming to the treatment, there is no cure for Lafora. Very recently, it has been adopted into the family of glycogen storage disease, and metformin has been accepted as an orphan drug. There are myriads of strategies and researches going on, but they are still in the state of infancy. So coming to the case in brief, We have this 20-year-old female. She's born to consanguineous marriage. She was absolutely normal till the age of 16 years. She was having a normal scholastic performance. She was good singing, dancing, and whatnot. At the age of 16, she gets his first episode of seizure, which was progressively worsening in nature. Earlier, it was once in 3 months. It became twice in a month, 10 times in a week. And then at the time of admission to the hospital, it was minimum 20 episodes of seizure per day. All the investigations, MRI, brain, EEG, skin biopsy, and genetic testing confirmed her suffering from Lafora body disease. Upon examination, we found the patient was drowsy but arousable. She was generally hypotonic, and she could not apprehend the instructions given to her for the CNS examinations. And upon Dashavida Pariksha, we found the Vada Pradhana Tridosha affecting this patient in her Balyavastha, her Balang being avaram, Sattva being avaram, Abhyavarna Shakti, Jarana Shakti being avaram, the Roga Bala being pravaram is affecting all her Dhatu, Mala, and Shrotas. Upon Ashtasthana Pariksha, we found the Nadi to be Vadigam, her Mutram, Avilam, Malam, Badham. She used to pass bowel once in only 5 to 6 days, Jivva Ubaliptam, the Drik were Bhrunartanam, Akriti Shina Shushka Deham, and Shabda Mukam and Aspashtam. So coming to the Ayurvedic perspective of understanding the disease, I would like to pin it under the category of Adibala Pravritta Vyadhi as per Shushruta's classification because of the Bija Avayava Dushti that is inherited from the patient. Looking upon the predominant symptoms of seizure, it can be correlated to the apasmara. Considering the vegetative state of the patient, it can be related to the Shoshavastha. However, the Samprapti begins with the Bija Bhaga Avayava Dushti of Mamsa Dhatu, causing Dushti and Shaya of Uttara Dhatus by means of Anulomak Shaya. Because of this Dhatuk Shaya, there is Vada aggravation. The turbulent Vayu fans up the Agni, makes it Vishama Agni, and the entire Dhatu Vyuha Karana is disrooted because Ama comes into action. Now, the entire Samprapti, if compared to the modern, it shuttles back forth in neurometabolic pathway. So, to break the chain of Samprapti, first thing we need to do is Nidana Parivarjan, that is to drive the public awareness to avoid the consanguineous marriages. In Vyadhi Vyakta Avastha, we can do is Patnam, Ama Pachanam, Apni Deepanam, correction of Vada in the order of Samanan and Apanan first, then Vyanan, Udanan, and Pranan, Ojo Vardhagam, Shodhanam, Mrudu considering the bala of the patient, and finally administration of Rasayanam. So let's have a glance at the therapeutic intervention that we gave. Initially for Vada Pitta Shamanam, Drakshadi Kashayam and Ashwagandha Arishtam was administered. Parallelly, Talam with Panchagandha Churnam and Shirabala 101 Avarti as well as Hastapada Abhyanga with Shirabala 101 Avarti was given to the patient. These two procedures will be explained in the later slides. The diet was critically analyzed as we gave her Drakshadi Lajapeya, Mudga Yusham with Ashta Churnam, Amalagi Swarasa and Tadima Swarasam was given at various times. Now, to get rid of the Purana Mala, Shodhana was given, that is for the correction of Apana Vayu, Pipalyadi Anuvasana Vasti, Erandamuladi Vasti, then Mustadi Rajayapna Vasti. Post Shodhana, a disease-specific Kashaya Yoga, Balakanaga Patradi was opted. Along with that, Kalyanaga Gridam was given as a Shamana dose of Snehapana. In the second stage, Kushmanda Surasa Gridam was given. We gave her Shirodhara with Kshira Kashaya made up of Sapnya Sthapana Gana. Then, in the Brahmana stage, Kaya Segam was done with Lakshadi Tailam and Bala Tailam. Then, after that, Mustadi Rajayapna Vasti was again given for the Shodhana. Jihva Lebana with Kalyanaga Valeha Churnam and Saraswata Grida was administered for the Vak Pravati. In the terminal stages, we gave her Dhmana Nasya with Sapnya Sthabana Gana Churna, followed by Nasya with Purana Grida, and lastly, Sanni Giri was administered to the patient. Now, after the entire Shamana and Shodhana Chigilsa, we opted Chavana Prasha as the Rasayana Dravya. Initially, we gave 5 grams of Chavan Prasha, which was gradually increased in the dose till the patient could consume it as Prasha Leha, excluding the entire diet, one meal of her diet. Now, I need not introduce Chavanprasha to everyone because it's an integral part of every Indian's life. But the question is why Chavanprasha was selected in this Lafora body disease is that the novel hallmark of Lafora includes the reactive glia-derived neuroinflammation and the upregulation of TNF and IL-6. And there are research papers which prove that the Chavanprasha reduces the inflammatory cytokines and also reduces the transcript levels of IL-6 and TNF significantly. Another important treatment administered here is Vasti. One could find a plethora of scholarly articles on the effect of Vasti as well as Shodhana on the gut microbiota. And they have already established that there is downregulation of the pro-inflammatory cytokines and ameliorating the helper T cells because of the Shodhana and Vasti. Again, I have quoted few effects of the Rasayana because the diligent researches conducted by the eminent physician Dr. M.S. Valyathan sir, it yielded significant insights on the effect of Brahma Rasayana on the fly models. So it states that this Rasayana has an important significant impact on the genetic integrity and suppressing the neurodegeneration. So the administration of Rasayana serves as an indispensable pillar, augmenting the treatment efficacies then by making a rejuvenation at that particular level. Now, coming to this Kerala Ayurveda Chikitsa treatment modality, that is talam. It is the application of two medium. One is lipid soluble and one churna medium at the bregma portion of the scalp. Now, the absorption takes place through the keratocytes. Through the shunting route, molecules are absorbed to the sweat glands and the sebaceous glands. And also the drug molecules can also be diffused through the highly vascular Haversian canals of the flat cranial bones. Over and above this, there is an indeed intriguing fact that there is a resemblance between the two terms, talam and thalamus. The parallelism lies in the fascinating fact that talam is applied to stimulate the thalamus, and the convergence between these two terms reflect the connection between the neurobiology. Another important treatment that we offer here is Hastapada Abhyanga. This treatment plan is intertwined to an important structure of the body, and that is fascia, which is already forgotten. And the father of osteopathic medicine, he puts forward a concept of fascia as the probable matrix of life and death. So after the Hastapada Abhyanga, there is a mechanical force generated which is converted into piezoelectric energy. So in that way, the sympathetic system activities are suppressed, parasympathetic activities are enhanced, and after Hasta Abhyanga, there is stimulation of the insular cortex. After Pada Abhyanga, there is stimulation of the cingulate cortex. So in short, the Hasta Pada Abhyanga, they bolster the autonomic nervous system. Coming to the discussion, the Chikitsa was attempted to correct the gut dysbiosis by Pajana Pathya Sevana Agni Divana, the reinstating the brain homeostasis by blood-brain barrier patch-up. The gut dysbiosis correction helps in inflammasome activation and reducing the lipid peroxidation. All the Shodhana and Shamana Kriyas that had included Snigdha Dravyas were aimed to alter the blood-brain barrier permeability and for better drug absorption. The next question is, what is the goal of the treatment? Now, our aim was to address the frequency of these seizures, which was 25 times per day, and it reduced to once or twice in a day after the treatment got over. So in that way, we were able to control the disease activity. And the patient started to eat properly. She started to pass her bowel daily. She started to respond to the stimulus. She started to speak monosyllables. In that way, we were able to improve the quality of life to some extent. We wish and hope to extend the disease-free survival of the patient. Now, we know that the disease is going to kill the patient in a duration of 10 years from the onset of his first symptom. So in that case, opting out is very easy, but the challenge is to give a try. This would help these patients live a life with improved quality with whatsoever life they are left out with. And this would spawn an unprecedented era of hope to the families mazing through difficult times. At the end, I would like to share the glimpse of this patient. A consent from the patient's mother was taken. This is one episode of myoclonic jerk that the patient got. She started to speak. Coming to the conclusion, I would now state Lafora as a ticking time bomb placed in a child's lap. For 99.99% of the population, the word Lafora may just mean a foreign locale or an exotic place or a drug species. But for these children, it is the worst nightmare. Seeing this young soul fade away is really gut-wrenching. Time is the essence for these children, and every moment counts. I would like to end my presentation by placing on record a deep sense of gratitude to my department teachers for their constant support and guidance. I'm very much thankful to to the Institute of Traditional and Complementary Medicine, Czech Republic, for providing me this online platform to be able to share this piece of knowledge with all of you. Thank you once again.
Thank you very much, Ms. Narendram. Do we have any questions here in the hall? No? No. Okay, so thank you very much, Ms. Narendram.
Thank you, ma'am. I can stop sharing, right?
Yes, please. Okay. Thank you. Okay, and now next, our next guest with a recorded video is Dr. Geetu Balakrishnan.
First of all, I'm very much happy to be part of this wonderful event, and I take this opportunity to express my sincere gratitude to all the organizers of the event, especially Dr. Thomas sir, for giving me this wonderful platform. I was lucky enough to be part of this conference 2021 also. And first of all, thank you. Human body still remains an enigma with its complex and chaotic system characterized by irregularities and unpredictabilities. And also it's being non-linear for its every aspect of physiology and pathology, and this being always being a repository of probabilities, there are always chances of permutations and recombinations. Such an uncertainty is well reflected in every aspect. I feel that even for the treatment aspect also, as alterations in the pursuit of vision, starting from the very first microscopic reductionistic approach to recent approach of magnified holistic approach. And what I felt is this is very much evident in the recent years for the paradigm shift happened for the disease causing theories, starting from the very first germ theory to the recent concepts of oxidative stress theory and free radical theory, etc. Also, and every pathology trails a chronology for its inception, of which autism is of no exception. And when we look into the history of the advancement of the disease, it was initially being pondered as a mere psychiatric disorder of schizophrenia, and it took over these years to reach the current status of autism spectrum disorder. Also, and it was with all this in background, a team of researchers embarked, including me, embarked our journey of inquiry, which eventually ended up in this clinical trial as a microbiome, which finds out human gut microbiome as a potential factor in managing autism spectrum disorder. So for the next 15 minutes, we will be discussing on this clinical trial. And autism spectrum disorder, as you know, is a lifelong neurobehavioral disorder which has been reported with an incremental surge. And this is being unanimously reported by CDC, that is Center for Disease Control, World Health Organization, with prevalence of 1 in 100, 1 in 54, etc., etc., etc. Also, along with the huge parental stress affecting the family relationships and environment, it has hiked up to the status of a global burden, exerting much adverse economic impact. And these are some of the statistical data on the expenditure being done for the management, diagnosis of this is in most of the developed countries. And it's in this scenario, when the whole world is tumbling in the gloominess of autism, let's have an overlook onto the dependency of the common mass on complementary and alternative medicine, making upon 80.9%. And though it's been a victim of virulent debates on etiologenesis, and also still till date, we couldn't find a reliable biomarker for the treatment of the condition, and still continues as a matter of speculation. Also, there are recent conventions on invariable connectivity between the traits of autism and dysbiosis under the heading of gut-brain axis. Moreover, there happens a springing up of probiotic industry in the management of this. And with all these in background, we could come to a conclusion that the gut microbiome or the gut itself is a potential, or to be more specific, one of the most influential modifiable factor in the management of autism. Also, the crux of Ayurveda principles have always given importance for the gut health in both etiopathogenesis and management of any of the pathology. So here we are with the first evidence-based clinical trial connecting autism, gut health, and Ayurveda. Moving on to the aim, this trial was being aimed for assessing the efficacy of a gut therapy protocol, which was being developed in the management of autism features and to assess the dysbiotic changes of gut microbiome in children who were suffering from autism. And the long-term objective was the formulation of a non-linear comprehensive perspective model for the management of autism. And this was being conducted as being supported by the government of India, that is the Ministry of Ayush, Ministry of Ayurveda, Yoga, Naturopathy, Unani, and Siddha and Homeopathy. This is a funding agency, and this is being registered with the Clinical Trial Registry of India. The assessment criteria used were CAS scoring. It is some almost 15 heads were being assessed in this CAS scoring. This is usually used scoring for assessment of autism, that is childhood autism rating scale. And we developed an Ayurveda gut health questionnaire, which was also being used as an assessment criteria. And for the stool samples collected for the initial screening and after 1 month, that is for the 1 month after 1 month of treatment and after 1 month of follow-up, the stool samples were collected and 16S rRNA sequencing was being done. And also GI severity index was used for the assessment. And all the parenting figures of children diagnosed with autism based on DSM-5 criteria between the age group of 3 to 12 years without discrimination of sex, religion, and economic status were included in the clinical trial. However, all the children with any of the comorbid conditions like cerebral palsy, mental retardation, or any other sufferings like coma, paralysis were excluded, and all the children on any of the medication, including anti-epileptic medications, as usually epilepsy is one of the common comorbid condition usually associated in autism children, or children on probiotics or any long-term or recent antibiotics or any other medications from any of the stream of the medicine were excluded from the trial. Moving on to the methodology, the entire trial was conducted in 3 phases as baseline, interim, and follow-up phase. In the baseline phase, based on the inclusion criteria, we have screened for about 60 patients, and they were selected and they then were randomized into 2 groups as control group and intervention group, with 30 participants in each based on simple random sampling technique. And in the interim phase, this is where we give all the intervention. This was the phase where we give all the intervention, and for the 2 groups we give intervention, that was multimodular intervention with 2 months of speech therapy, occupational and behavioral therapy, along with parental guidelines for food and lifestyle modifications for both the groups. However, for the intervention group, additionally, we have given 1 month intervention using Ayurveda medicines. That is, these include 2 polyherbal Ayurveda compounds. That is a powdered form of Rajanyadi Churnam, and the other one is a pill or a capsule or a tablet form, that is known as Vilvadi Guliga. These 2 are 2 time-tested Ayurveda drugs which are being commonly used in the country of India for treatment of, and these 2 are time-tested drugs. And in the follow-up phase, we have done the assessment criteria, which we have already discussed, and this was done on the screening day, that is 0th day, and after 1 month of treatment, and on the 60th day, that is after 1 month of follow-up. These are the methodology in detail, wherein we have done the screening, allocation, protocol, intervention, assessment. And in the interim phase, as we have already discussed, the 2 polyherbal medicines were being administered for a duration of 30 days, and these were done thrice daily, 30 minutes before meals, along with lukewarm water. Also, both the groups, that is the control group and the treatment group, were being given with a prescribed and structured food and lifestyle guidelines based on Ayurveda epistemology during this duration. And moving on to the results from the test of within subject effect for overall gut health assessment done by Mauchly's test of sphericity, we could found that the time treatment interaction was found to be very much effective, which means that the changes happened during this clinical trial was not caused due to the factor of time. Also, from the results of test of within subject effect for the different measures, as already discussed, there are some 15 headings or points we assess under this childhood autism rating scale, and it was found that the mixed model ANOVA time treatment interaction was found to be effective with p-value less than 0.005, which means that significant effect of treatment on total score was found. And this was the profile plot for the overall gut health assessment done for both the control and intervention group plotted against time. And this was for the GI overall results plotted against time. And the two table of means for overall gut assessment was being statistically analyzed, and a significant increase in the mean score of overall gut assessment in the intervention group was obtained when compared to control group. And from the output, it could be inferred that this Ayurveda intervention along with lifestyle guidelines can lead to positive impact in the gut health status. Also, for the summary statistic for the different measures, it was found that through CAST, significant decrease was obtained in the mean score of the intervention group when compared to control group with p-value less than 0.05. You could see that initially it was 46.393, and at the time point 3, that is after 1 month of treatment and 1 month of follow-up, this came down to 40.625 in the intervention group. And for the result of GI severity index, a repeated measure ANOVA with greenhouse Giesser correction was assessed, and the estimated marginal mean in control group showed a reduction of 1.06 points, while in the intervention group, the reduction was 2.9 points from the time point 1 to time point 3, indicating that the effect of treatment was far better in intervention group compared to the control group. A groundbreaking blow away to all the existing pathologies was done by biologist Alana Collin in her best-seller book entitled 10% Human. And she was purposefully given this name of 10% human, estimating the presence of a third player which sits uncomfortably between nature and nurture, the microbiome. She bases her book title as 10% human on estimation that the human cells in our body are outnumbered by microbial cells 9:1, making upon 90%. And it was with this riveting focus on the intricate relationship between human body and microorganisms has drawn our attention, eventually ended up in this clinical trial. Moving on to the results of the microbiome, results of the 16 srRNA sequencing of stool samples. While comparing the top 10 genus obtained before and after treatment, we could found that there was an increase in the presence of the beneficial bacteria of Bifidobacterium and a decrease in the presence of the harmful bacteria or pathogenic bacteria of Clostridium. And this difference in the microbiome marker points onto the establishment of a well-balanced possible establishment of a well-balanced ecosystem that is without affecting the co-location and co-functioning of microbiome. And also the microbiota diversity analysis was being done based on alpha diversity and Shannon matrices. Also the heat map for top 25 genus and 25 phylum was also being calculated. And this was the alpha rarefaction plot, which was being which is known as the gold standard to appraise the diversity of species within a sample, was also being done using the common matrices to know the evenness and richness of the species. And also the both weighted and unweighted unifrac TCOA plots to analyze the beta diversity using the distance matrices was also being done. And however, till date, the most recent approaches known for the management of this dysbiosis is fecal microbiota transplantation, that is FMT, and probiotics. However, we could see that in FMT, the replacement is being done only with the beneficial bacteria. And also in FMT, dominance of highly pathogenic bacteria is being reported. And in prebiotics and probiotics also, the replacement is being done only with the beneficial bacteria, cause much distortions to the naturally existing co-functioning of species. So the whole world, what we felt is that the whole world is in the search of a midway, an alternative for this existing dilemma, for the establishment of a well-balanced ecosystem. And an inkling from this thought fueled our curiosity has made us to undergo the 16S RNA sequencing even for the Ayurveda polyherbal compounds to uncover their beauty, and most astonishing results were revealed for us from this results, as we could found that these two drugs too encompassed the presence of pathogenic bacteria. However, till date, not a single catastrophe or any of the comorbidities have been reported related to these two time-tested polyherbal compounds. And more pragmatic and empirical attestations on this could be obtained from this, that is the annual turnover of these two time-tested drugs for the year 2020 to 2021, the state of Kerala, which is just one state in India, and the annual turnover of these two time-tested drugs is 2,12,450 units for Vilvadi Gulika and 2,32,500 units for the powder, that is Rajanyadi Churnam. So we could found that we understood that health and ill health need to be assessed clinically, then always trying to be assessing that based on the microbiological point. So, and there are a lot of factors having invariable connectivity to dysbiosis, and Bruce H. Lipton in his book The Biology of Belief have mentioned about various factors having invariable connectivity, and he had concluded that all these factors could be encompassed to the four domains, that is the thought process of individual, environmental factors, food and drinks, and activities of daily living. And we found that this falls within the vicinity of the recent concept of epigenetics. And the recent approaches of lifestyle medicine has observed the same factors like healthy eating, mental well-being, healthy relationship, physical activity, minimizing harmful substances, and sleep as the 6 pillars of health. So to conclude with, this tested protocol was found to be highly effective with statistical significance in improving good bacterial colonies and to reduce the harmful bacteria colonies, helping to maintain a healthy bacterial equilibrium, resulting in the proper management of dysbiosis in children with autism. Also, both the time-tested drugs of Vilvadi Gulika and Rajanyadi Churnam shows high abundance of several organisms which are in equilibrium of healthy ecosystems so as to manage the dysbiosis in children with autism. So these are the references, and I take this opportunity to express my sincere gratitude to my team, my workplace, that is Kerala Ayurvedic Kottakkal Ayurveda College, and all the authorities. And once again, I take this opportunity to express my sincere gratitude to all the organizers for giving me this wonderful platform, and hope to see you in the next World Health Congress too. Thank you. Thank you, one and all.
Dr. Balakrishnan is connected with us over Zoom. If anyone would like to ask her any questions.
I don't know. Thank you so much. I don't know your name, but my question is, because that was a trial, I don't know if she's hearing us.
Yes, sir. It's audible. I'm here.
So you had 3 phases, which was baseline, intervention, and follow-up.
Yes.
First, I want to know, did you have any drop in any of intervention or control group in the follow-up stage, which may affect your statistical analysis? And the second question is, what were the main challenges, especially in the intervention stage for you? Because definitely, as you know, the intervention stage is important because address your objectives, which is to measure the effectiveness of the intervention. I just wanted to know about these two questions. Thank you so much.
Yes, sir. Thank you for your questions. Yeah, there were really dropouts were there during the study because during the answer for the second question is, were there mainly any the hazards we faced during the trial? Yes, and that too was that some of the patients, especially autistic kids, they are of mainly of low immunity, and gastrointestinal diseases are very common in them, and they are bound to infectious disease very frequently. So for almost some 4 or 5 patients, we could see that they have to drop out this, and since they were on antibiotic medications, so we were supposed to drop them from this protocol, because you could see that in our exclusion criteria we have kept that any of the children having any of the intervention were excluded from the trial. So some 4 or 5 patients were excluded.
Thank you for your answer, doctor. Any other questions? Okay, so thank you very much for your presentation.
Thank you.
And now I would like to invite Associate Professor Dr. Gulay Yilmazel from Turkey. Welcome. Here's the microphone. And here's the pointer. Okay. You can control your presentation.
Okay, thank you.
Thank you.
We are from Turkey and from Hitit University. My specialist is public health, so my research article not on Ayurveda, public health, preventive medicine. Our research title is The Relationship Between Quality of Life and Mental Health Status in Unoperated Elderly Cataract Patients. Okay, now, okay. Thank you. And what is the cataract? The cataract is clouding of the lens of the eye that affects vision, and it is imparted public health problem. As the most common cause of blindness and visual impairments, cataracts are often associated with aging and can cause mental health problems in elderly people. What's the objective? The study was to aim to determine the relationship between quality of life and mental health status in unoperated elderly cataract patients. This is a descriptive study and conducted with 183 patients in eye clinics of training and research hospital. And the hospital is located in central Black Sea region of Turkey, and the data was completed during March and June 2022. It is a face-to-face interview method. The questionnaire form was included, socio-demographic information form, the hospital anxiety and depression scale, the quality of life scale, and the blindness scale. We can examine this case. First of all, the hospital anxiety and depression scale aims to measure symptoms of anxiety and depression and consists of 14 items and 7 for anxiety and 7 for depression. Each item is scored on a response scale, and the scores ranging between 0 and 3, and also there is a cutoff point for depression 8 and for anxiety 11. The other scale is quality of life. We used Turkish version. The scale consists 13 items. Items are in the form of also 4-point Likert type, and scores range between 0 and 3, and total score also 0 and 39 points. High scores indicate the high quality of life, and in the study the median score was 18. And the other scale, Linus scale, 20 items. Each item is scored on 4 points, and also points range between 1 to 4. The total score range also between 20 and 80. Higher scores indicate a greater perception of Linus, and this study, the median score was 28. The data were evaluated with SPSS 21 package program. Percentage mean chi-square test, Spearman's correlation analysis were used. In evaluations, P small 0.05 value was expected as statistically significant. And what is the results? Of the research group, approximately 74% were 65 years and older, 60% were women, 68% were married, 65% were under high school education, and 61% had any chronic condition. And what is the scores? In our study, 88% of the participants had depression and anxiety, and 50 approximately percent had Linus, and 49 approximately 50% of people had a high level of quality life. And according to mental health status, for quality life, low level of quality life was common among people with depression, with anxiety, with Linus. And there is a relationship between quality of life, also a negative relationship, age, depression, anxiety, and Linus. And what is the conclusions? Quality of life was a prominent factor on mental health status of elderly people with unoperated cataracts. Mental health screening and psychiatric consultation may be recommended in elderly cataract patients. Thank you.
Okay, thank you. Any questions?
Thank you so much, Doctor, I can say. Yeah, thank you so much for your presentation. You had 183 participants. What were the exclusion criteria?
65 years and older, and unoperated cataract.
Yeah. So you had about 68%, I think, those who were over 65 years old. You know, in the gerontology, the definition of elderly or elder people is over 65 years old. So what was your definition of elderly in your study?
According to the World Health Organization age group for elderly, 65 and older.
So if 65 and older, why 68% of your participants were 65 years old?
I want to look my power.
The first table of the results. Yeah, here. 73.8%, the previous slide, were 65 years old and
yes,
over.
Yes.
So if your participants were defined as older people, they should be 65 years and over. Why 22.2% of them were less than 65%?
Okay, I understand. The other groups were 50 years 50
yes. Less
and
than 60.
64 age.
So your participants were older, but not older age as a definition of.
Okay.
That's fun. So what was the ethic aspect in your study as you should consider, because that topic was among older people? You know, older people can consider as a high risk target group, yes or not? Pregnant women, children under 5 years old, and older people. Okay. So what was the ethic aspect of your study? Thank you so much.
Thank you. We take our ethic approval from University Ethic Committee and our eye clinics. We talk with their doctor and we took their approval. Consult. Evet. Thank you.
Any other questions? Okay, thank you very much. And thank you for coming to share your knowledge in person. Thank you very much. Okay, and our next guest from India is Dr. Pritam Pai. Okay, so we will play a recorded presentation.
Good afternoon, everyone. Respected organizers and dignitaries present today. The topic of my presentation is Management of Cerebral Palsy Using Ayurvedic Treatment Principles. Today I'll be presenting the case series. Cerebral palsy is a neurodevelopmental condition and it affects muscle tone, movement, and motor skills. As we know, it is not a single disease, but a heterogeneous clinical syndrome and develops from the damage to the developing brain. The definition of CP is: cerebral palsy describes a group of permanent disorders of development of movement and posture causing activity limitation that is attributed to non-progressive disturbances that occurred in the developing fetal or infant brain. The motor disorders of CP are accompanied by disturbances of sensation, perception, cognition, communication, behavior, epilepsy, and also secondary musculoskeletal problems. It is a permanent damage to the developing brain and hence leads to physical and mental disabilities, due to which the child is completely dependent on his parents throughout his life. The global prevalence of CP is 2 per 1,000 live births, and in India, the prevalence is 2.95 per 1,000 live births. Henceforth, I'll be mentioning cerebral palsy as CP throughout the presentation. The causes of CP are divided into prenatal, natal, and postnatal causes. I'll be mentioning the common causes. Under prenatal and natal causes, we have prematurity, that is preterm deliveries, which causes periventricular leukomalacia, intraventricular hemorrhage. So these are the main causes for the diplegic type of CP. And then other causes are hypoxic ischemic encephalopathy, neonatal hypoglycemia, congenital abnormalities of the brain, such as it may be because of inherited malformations or it can be secondary to infections, radiations, toxic drugs like anti-epileptic drugs. Multiple birth is also a cause, stroke, intracranial hemorrhage, intrauterine infections. Under the postnatal causes, we have stroke, head trauma, and meningitis, meningoencephalitis. Among the causes, as mentioned before, the common causes are CNS infections, which is around 57.4%. This is followed by the second common cause, that is birth asphyxia, which is 51.9%. The comorbidities which are commonly seen in CP are speech problems, which is 83%, followed by microcephaly, seizures, and intellectual disability. The common neuroimaging findings which we come across are hypoxic ischemic changes and periventricular leukomalacia. Types of CP are 4: spastic, ataxic, chorioathetoid, and mixed. Out of this, the spastic CP is the most common. The management of CP involves a neurological rehabilitation where the abnormal muscle tone is addressed using physical and occupational therapies. Along with that, the diagnosis and management of comorbidities is done, such as management of epilepsy, impairment of cognition, vision, hearing, disturbances of growth, and gastrointestinal function. The management is therefore multidisciplinary and it involves the treating physician, that is a pediatrician, along with the team of specialists from areas of rehabilitation, orthopedic, psychologic, and social care providers. Along with this, there are surgical interventions also. For example, tendon lengthening, tendon transfers, selective dorsal rhizotomies for the management of the spasticity. Botulinum toxin type A injections are also given, or baclofen intrathecal injections are given. These are only the temporary measures, and these are short-acting drugs, do not provide complete relief to the patient. Surgical procedures mentioned above are also associated with complications, and they just reduce the spasticity, but there is no improvement in the motor functions. As there is no cure available for CP, the main aim is to maximize the child's functional capacity and make him or her as independent as possible. And this is also what we try to achieve through our Ayurvedic management. Till date, no oral medicine is available in the modern system of medicine to improve motor functions. In my 15 years of experience in treating patients of CP, I have seen good improvement in the motor functions and also a reduction in the spasticity by advising Ayurvedic medicines and also Panchakarma therapies. When we are considering the clinical features of cerebral palsy, we can compare it to Vata Vyadhi. So Vata Vyadhi is a disease which occurs due to the abnormal functioning of the Vata. It is mentioned in our Ayurvedic textbooks. So little information about the Vata Vyadhi itself. Acharya Charak has mentioned various causes, that is excessive indulgence in diet, such as which have the qualities of roughness, cold, or eating less quantity of food, faulty therapeutic measures such as faulty Panchakarma procedures, excessive activities such as leaping, jumping, wasting of dhatus or emaciation due to diseases, anger, day sleep, suppression of urges, injury to the marma. Marma are the vital organs. For example, head is also considered as the marma. And injury to the head, that is injury to the brain, also leads to Vata Vyadhi. And we know that brain injury is one of the main cause for cerebral palsy. The causative factors I have divided into antenatal, natal, and postnatal causes. Under antenatal causes, Acharya says that Garbhopaghatakara bhavas. So Garbhopaghatakara bhavas are the factors which harm the fetus. So faulty diet followed by the mother during pregnancy, such as Guru, Katu, Ushna, Tikshna Ahara, and faulty regimen followed, such as excessive activity, excessive walking, then it causes fetal anomalies and also preterm birth. Akala Pravahana Janya Vyadhi, that is when the pregnant lady during delivery, if she bears down in the absence of contraction, then the child will be either lame or dumb. Prasava Kalina Vyadhis, if there is obstructive labor and forceps was introduced. If this causes the head injury leading to brain damage, then it can lead to various diseases like ardita, facial palsy, chakshu vibhrama, abnormalities of the vision, loss of motor functions, there is muteness and stuttering, and also loss of speech. Pranava sroto dushti, if the child had birth asphyxia, then due to this pranavaha sroto dushti, it can cause the dushti it will hamper the functioning of both the jnanendriyas and the karmendriyas. Hence, it causes abnormalities of the vision or loss of vision, loss of hearing. The child is unable to walk, no control over urine and also feces. So all these are seen in CP. Postnatal causes, apaghata, that is injury to the head. Graha Bada, especially the Skanda Graha, has got features similar to the hemiplegic type of CP. So CP, we can correlate it to various Vata Vyadhis such as Pakshaghata, Ekanga Roga, Sarvanga Roga, Fakka. and also Skanda Graha. The management of Vata Vyadhi depends on whether the cause is Dhatukshaya or it is Avaranajanya Vata Vyadhi. Hence, the treatment protocol changes. In the management of Vata Vyadhi, various internal medicines and external treatments are advised. External procedures, that is Panchakarma procedures like Abhyanga, Sarvanga Swedha, Ekanga Swedha, Basti, are used to treat. Udvartana is also a procedure which is advised. It is massaging the body using medicated powder, which are Vatahara in nature, in the direction opposite to the hair follicle. So here we can use Kola Kulatyadi, Kulatta, Trifala Churna. Abhyanga is also beneficial. It is oil massage which is done all over the body using Vatahara Tela like Dhanvantara Tela, Bala Tela, Bala Ashwagandhadi Tela, Mahamasha Tela, Kshira Bala Tela, to name a few. Abhyanga pacifies Vata and it helps in the promotion and regulation of the proper functioning of the Vata. The other external procedures Snehana are Sarvanga Dhara, Shashtika Shalipinda Sweda. Then there is Niruha Basti, Matra Basti. Oral medications like Kalyanaka Grata, Maha Kalyanaka Grata, Kalyanaka Avaleha Churna, Rajanyadi Churna are beneficial. Now coming to the case report, this is a female child, age 4 years. And she came to me because she was not able to walk properly. She was walking on toes and she was not able to hold objects with her hand. In the history, there was a history, in the birth history, a history of prolonged labor. And hence she was treated on the principles of management of Vata Vyadhi itself, Pranava Srutodushri, and hence she was treated with Udvartana using Kolakula Tadi Churna for 7 days, Abhyanga with Dhanvantara Taila 7 days, Sarvanga Dhara with Sarcharadi Taila for 7 days, Mahakalyanaka Ghritam and Rajanyadi Churnam. So this was given for a period of 3 months. And Panchakarma procedures were done in 2 sittings of 3 weeks. So here you can see that she is walking on her toes. That was before treatment. After 3 months, you can see how slowly she is walking, keeping her feet firmly on the ground. This is another girl, female child, age 2 years. She was unable to stand for a long time without support, unable to walk without support. And birth history, she had history of birth asphyxia. All her milestones were delayed. Again here, Vata Vyadhi management, because Shiromarma Vighata being the cause. Abhyanga with Dhanvantara Taila, Vatahara Taila for 7 days, followed by Shashtika Shalipinda Sweda, which is Brahmana in nature, for 7 days. Matra Basti with Dhanvantara Taila for 7 days. Oral medicines, Kalyanaka Ghritam, Kalyanaka Avaleha Churnam, Rajanyadi Churna were advised. And she was given treatment for a period of 6 months, oral medicines for 6 months. Panchakarma was done in 2 sittings of 3 weeks duration. So before treatment, you can see her quality of life, which was 4. We had assessed that using Barthel score. And after the treatment, it was 28. Receptive language was 6 to 7 months. And after treatment, 10 to 11 months. And spasticity, which was grade 2, reduced to grade 1. And lower limb, the muscle power was grade 3, which improved to grade 4 in of the lower limbs, left and right also. Head holding, which was 4, improved to grade 5. And standing, which was grade 0, she was having, it was improved to grade 2. Male child, age 6 years, unable to raise a left hand and not able to hold things in the affected hand. Birth history of asphyxia present and on ventilator for 15 days. On examination, muscle bulk was almost normal. Reflexes exaggerated in the left upper limb. Gross motor milestones achieved on time. And fine motor milestones is not able to close the button of the shirt. So he was again treated for 3 months. So initially, the spasticity which was present at the elbow and wrist joint, after a month, it completely disappeared. So it came to grade 0. And muscle power, which was grade 2, improved to grade 5 after 90 days of treatment. Motor functions also improved. He is able to hold objects and use his left hand. So Udvartana with the Kola and Kulatta Churna was done for 10 days in 3 sittings. He was given Mahakalyanaka Ghrita and Hingvashtaka Churna for a period of 3 months. So another patient, male child, and not able to walk without support. He came to me at the age of 3 years, not able to speak words and sentences. The birth history was meconium present, convulsions present after birth, delayed developmental milestones such as sitting, standing, and walking with support at 2 years. Before treatment, spasticity at knee, ankle, elbow, grade 1. After treatment, it reduced to grade 0. Standing was grade 4, it improved to grade 5. That is, he is able to walk without support. Fine motor, he was not able to close the button. Now he is able to close the button. Here also, the treatment was given for a duration of 6 months, and the Panchakarma also was done in 2 sittings in this patient. Here also the oral medication Mahakalyanaka Ghritam and Kalyanaka Valeha Churna was given. Thank you everyone for giving me an opportunity for presenting today in the World Health Congress at Prague. And thank you so much. And if there are questions, I would like to answer them. Thank you.
Thank you. Dr. Pai should still be connected with us over Zoom if anyone would like to ask her any questions.
Hello. Is Dr. Pai available? Okay. Hi. Thank you for all the case presentations. Would you be able to explain a little bit why Mahakalyanakam Ghritam instead of Brahmi Ghritam or Saraswata Churnam or Saraswata Ghritam? You know, how did you choose the Mahakalyanak, especially where convulsions were present post meconium swallowing, or the last case study? Why Mahakalyanakam? Thank you.
Yes. The Kalyanaka Ghritam reference comes in Fakkavyadi, where the definition of Fakkavyadi is the child is not able to walk. Even after completion of 1 year, if the child is not able to walk, the child is declared suffering from Fakkavyadi. So there Acharya mentions the use of Kalyanaka Ghritam. And with the clinical practice, even when I have interacted with Vaidyas and even with my own experience, what I've observed that there is improvement in the motor functions when Kalyanaka Ghritam is advised, especially with the severity. And if they have a history of conversions, then Mahakalyanaka Ghritam is more effective. That is what we have observed.
Thank you so much for answering that. One follow-on question is, sorry, go ahead. Go ahead.
No, I was just completing saying that I hope it answers your query.
One follow-on question is, how would you diagnose it as Fakkavyadi? Because Fakka is usually emaciation and stunted and, some kind of nutritional deficiency. So can you explain your nidana for this? Thank you.
The Fakka is of 3 types. There is Ksheeraja, Garbaja, and Vyadija Fakka. So the Fakka which I'm considering here is a Vyadija Fakka, where the child is not able to walk. And what Acharya has mentioned is that there's only one definition, that the child is not able to walk. So when we have a patient of a neurological condition where the child doesn't walk, then the easy history that the other milestones also were delayed. Yes, if we consider Vyadija Fakka, there are signs of malnourishment that is also present. Even in neurological conditions, you can see such presentation where there will be like weight loss, malnutrition, signs of malnutrition is seen. And hence, this being the Nidhan itself, was considered under Vyadhija Bhatta, and hence the line of management itself, even the Panchakarma procedures, if you would have observed, I have advised Udvartana and then Snehana procedures, Svedana procedures, which are also in the line of management of Bhatta also. Both Fakka and it's a combination of the line of management of Fakka and Vata. So both have been considered.
Thank you, Doctor. Thank you very much for answering the questions and for your presentation. And now our next guest from Australia joining us over Zoom is Miss Debbie Somerville. Hello, do you have a connection?
Hello, yes, thank you.
Thank you. Please proceed with your presentation.
Thank you very much. I'll just share my screen.
Yes, we can see your screen.
Wonderful. Thank you for the feedback. I must say I'm really impressed with how professional this conference has been run. And on that note, I would like to thank the organisers and very much for doing so much hard work. I know how difficult it is to get so much organised with so many people involved. So hello, everyone. It's lovely to meet you. My name's Debbie Somerville, and I'm from Gold Coast in Australia. And it's about 9 p.m. at night time here at the moment. So I'm very pleased to be with you today. My goal is to create an advanced technology that works across all systems of the body in a selective way, and one that can adapt to each individual's physiological needs, and that can be used by all ages with no side effects. Sounds crazy, doesn't it? But it is real because we've made that happen. But that means functioning alongside pharmaceuticals and alongside vaccines or herbal remedies, etc., with or without them, without any adverse events. So to do that, I've been focusing on quantum physics rather than focusing on chemistry. So using a negative ionizer as a foundation, we've created cold air plasma, and that produces an abundant supply of molecular hydrogen, H2, for the human body. And it's built in such a way that each person's body can regulate the amount of the supply that is required for that individual's needs. And as you know, H2 is the master metabolizer, and we've witnessed enormous benefits to humanity, where the more comorbidities a patient has, the better the results that they achieve. So this technology has now attracted quite a wide view from science and medical fraternity around the world. And today what I'm going to do is show you how it's impacted the lives of people that it's been used on. And then I'll explain a little bit more about cold air plasma for those that might not have been exposed to that at this stage. So first of all, why do we need to have a systemic approach to human health? And of course, as we all know and are all very, very much aware of, our environment is not what it used to be. And therefore, the cells of our bodies are not coping like they used to. So our food is not as nutritious as it used to be. Our water is not as clean. With geoengineering now, the air around the entire globe is being impacted by what's happening in the ionosphere and all the interruptions that it's had. And that's not even looking at what happens to us on an individual basis, where we're sleep deprived, where we're so busy in our modern lives that we forget to drink and we forget to eat correctly. And so the combination of all this has really confused the communication networks between the cell membranes, where those receptors are picking up information from our environment, and then they need to translate that into information for the hardware of the cell to understand. And there's a lot of breakdowns now happening in both what the impact from the environment is and how the cell is understanding that. And so illness is increasing astronomically, even though we've got advanced medicines today than what we used to have. So humanity needs to have a systemic solution. And so this particular technology is very simple to use. You basically put it on your bedside table, you turn it on when you go to sleep, you turn it off when you wake up. And you don't even know that it's doing anything, because while you're busy sleeping and dreaming and snoring, this technology is having a quantum party inside your body. And that quantum party is basically using all the systems of the body that are restoring as you sleep to help restore better than what they used to. So basically, we're helping to put the body back into its natural balance so the body can heal itself. And it's used in the body in two different ways. One, through the respiratory system, and secondly, through the skin. So in Wuhan, at the beginning of this epidemic, I was in China and I was on the front line in Wuhan for January, February 2020. I didn't have very many of the technology devices there, but what I did have, I was able to turn into an 8-needle device so that we were able to treat at least 4 people per machine. We had very good success over there. At the PLA hospital and also up in the chest hospital. But unfortunately, when I returned to Australia, we were basically told that the government of Australia has decided to vaccinate the population and we cannot use the technology and we cannot talk about what success we had in Wuhan. So we were basically hidden from the world from that time onwards. So how did I get the results that I got in Wuhan? We didn't lose any patients. And basically what we did was we looked at a virus in a completely different way. I wasn't really interested in the spike proteins and how it attaches to the epithelial cells because that's all the chemistry side. But I do know from physics that it's possible that if you can work out how to resonate with something that's hard, then you can actually blast it. So that's what I was working on. So I know that the coronaviruses, for example, in humanity have a icosahedral shape. So the icosahedral shape is actually one of the highest in nature. And the icosahedral, if you count up the triangles, they're perfectly in line and they're perfectly sealed around a virus. And there's 20 of them. But no pharmaceutical company ever looks at that. And you don't blame them because it's like putting a motorbike helmet on your table and trying to use a pin to get through. You'll never get through it. It's very, very hard. But using physics, we can cause so much drama around that icosahedral that we can effectively twist it by using that drama. And that's enough to actually cause it to break apart. And we believe that was the mechanism of action that actually took place. Can we see that? No. Do we know that theoretically and from experience? Yes. So these 20 triangles around the icosahedral that hold all the RNA and DNA inside, they cycle at 3,600 times per second. So using Pythagoras' grid, his factor 9 grid, I was then able to work out that means it's creating a perfect A-sharp sound. So now I've been able to turn the virus into something that I can see, touch, smell, hear, using one of my human senses, and that was to relate to a sound. So then all I had to do was to actually resonate with that sound using the technology in order to get a result, and that's what worked. So around this time, I also set up, because I was not permitted to promote our success in Wuhan, and basically our health department had made us go quiet. And so I used this time to set up a hybrid clinical research centre and case study unit. And it's a decentralised hybrid clinical case study unit. And you can see here, the more comorbidities that a person has, the higher the results we're getting. And most people have on average 5.4 comorbidities per person. And you can see there's a huge range here of different conditions that people have. Now, this technology is not going to be, a solution for every single condition, but it is able to assist with the symptoms of these conditions, and it's able to assist enough that their doctors' recommendations even start to work better than without the technology. So we also undertook a study on almost 1,000 patients. 95% reported that they no longer suffer colds and flu. 90% reporting better sleep, for example, 89% relief of allergies and hay fever and so on. We tested phagocytes and we looked at how excited they became when they were put into exposure to the technology. And we also have a professor who did some studies quite a few years ago and showed that the immune system had a convincing probability of 0.001 of respiratory tract infections and spore precipitation being statistically significant. So this has a great impact for allergy sufferers, and yet it's been improved dramatically to what the technology used to be. This lady here has had severe eczema, 72-year-old, having to bathe every single night. She tried quite a number of creams over a period of time and not getting any results that was substantial. And so within 39 days, you can see there she's basically not having to bathe at nighttime, and she doesn't have any pain. So then we decided we would look at how much of the pathogens of the respiratory system can we impact in a time-limited space, so in a 3-hour period of time. Because when you use this technology long-term, every single night as you sleep, then eventually you get to the point where you just don't get colds and flus anymore, even when everyone around you is sick. And you might feel like sometimes you're coming down with something, but then you go to bed at night, turn the technology on, and by the morning it's all gone. And this becomes a very common theme amongst our long-term users of our patients. And you can see here 72% of pathogens on average was removed within the first 3 hours. So we don't encourage shift workers, for example, to only sleep next to it for 3 hours. They must have at least 5 hours plus per night to have an ongoing benefit to human health. And here is a gentleman with diabetes, and he had a diabetic foot wound. He was booked for amputation. He'd had a stent put in his leg, and then within 3 months using our technology, he was able to walk on the foot again and didn't need to have an amputation. This was Lyme disease. The lady even remembers the tick bite from 4 years ago. She's got severe welts, but the really big thing for her was by week 5, we were able to stop her brain fog. And that was a really big, significant issue. So she could at least get back to a normal lifestyle that she had experienced before. This was interesting surgical wounds, looking at 2 wounds created by the same surgeon, using same tools on the same day, same operation. And you can see one scar is dramatically decreased in colour and significantly improved in its scar healing. And the other one that was covered and used as a control, that scar is still looking quite inflamed and red. This lady had an abscess on her left jaw, and her professor in London, who uses our technology, also did some live blood analysis and sent it to us, which was very interesting to see the spiderwebby looks in when she had the abscess to when she didn't. And interestingly, that was using the red Mark III, and it was gone within 2 days. This gentleman also booked in for amputation of an ear due to a basal cell carcinoma. And interestingly, he'd been bleeding for every day for over a year. But like a lot of Australian men, they're very resistant to going to have proper medical treatment on things like this. And so he'd let it go for too long. And he didn't want it amputated. And I guess we were a last call for him. But as you can see, after 17 days of treatment, we were able to stop the bleeding. And after 47 days of treatment, we significantly decreased the inflammation and the carcinoma itself, enough now that the surgeon could actually work on his ear without having to amputate it. And this was a really interesting case. This case here led to the success we had in Wuhan. Because it was the first time we'd ever tested a breast cancer tumour that was 5 centimetres deep in the woman's breast. She had stage 2 infiltrating invasive lobular carcinoma. So we treated this breast transdermally. That means basically she spent 2 hours a day with a device close to the tumour site, and then she later had surgery. And as you can see, the tumour was removed, and we've got histopathology evidence to show there was no cancer cells left at all. So this took place for 4 weeks from her time of diagnosis to the time she had surgery. And so after surgery, there was no cancer cells in that tumour that they removed and excised. So this was a great story. But more than that, what IP that gave to myself was that, okay, we now know, and we now have evidence that this technology is able to go 5 centimetres deep through the skin. And we used that in Wuhan because some of the patients were intubated. And so using a couple of my LinkedIn surgeon friends, I was able to find that anatomically, if I'm able to roll a patient onto their side, put them in the fetal position, I can treat the lungs through the back. And that's what happened. So the 3 patients that I was permitted to treat that way in Wuhan all ended up having the intubation removed and they walked out of the hospital. So it was a great result. We've been also looking at lupus and transverse myelitis. So all these conditions are all over the place. And his sleep apnea machine with a patient, this was very interesting. Using his sleep app device alone, his blood oxygen levels reduced by 12.72% over 5 days.
You now have 2 minutes left.
Thank you. I was wondering what that bell was. And then 34% was when we introduced with it. So this is palliative care patient with improving his oxygen. I won't go through the video because we don't have time. And even though this provokes skepticism, it's quite common when there's a lot of, when a technology is working on the systems of the body. Why is it working? Because the body is water, the body is electricity, the body is light. And we're working on those foundational principles. And here is plasma. So there's solids. If you see a block of ice, liquids, it's water, gas, and plasma is smaller again. And if you just imagine the aurora here, that's all plasma. But to have that in your body, you'd have to have 200-kilometer long leads to reach the earth to be grounded. And as you can see, the green glow of the needles here is the plasma we've created. And this is all the different aspects of the technology to actually pull it together to create the master metabolizer for the body and the molecular hydrogen to help the body heal itself. And thank you very much for your time.
Thank you very much, Ms. Somerville. Any questions here in the hall? No, looks like not. So I will thank you, Ms. Somerville, very much for your presentation.
Thank you.
And what follows now is the lunch break, which will last until 3:15. And we invite you to visit a very unique art installation in the ground floor behind the dining hall. So please visit. And enjoy your lunch, and we will meet here again at 15:15. Thank you. Okay, so good afternoon, everyone. Welcome back to hall number 2 at the World Health Congress. And let's dive right in. I would like to welcome our guest, Ms. Pratibha Shah. Welcome. Please come forward.
Thank you. Let me know when you want me to get started. Start. Okay, this is my phone. Good afternoon, everyone. I want to thank the organizers to begin with for giving me this opportunity. And we have only 15 minutes. I'll just get started. So namaste from India. And right now I'm coming from US, Boston. So the topic I'm going to talk about is autoimmune diseases. This is a very, very complex topic. You all have heard of autoimmune diseases? Yes? For example, arthritis, eczema, psoriasis. These are all autoimmune diseases. Very complex topic, only 15 minutes. So I will try to simplify and explain what are autoimmune diseases. I will call it AD. Some of the facts, importance, and challenges. Mechanism of AD, how to recognize AD, and correlating AD with Ayurvedic principles, Ayurvedic approach to ADs. This is what I will try to do. I'll try to break it down. So what are autoimmune diseases? So our body has something called immune system. The function of immune system is to defend us. Okay? Just like in Czech, we have probably some army that is supposed to defend Czech Republic, right? And if the army turns against its own people, that is autoimmune. Okay? The function of immune system is to protect us from foreign agents, bacteria, viruses, fungi. But if you have been doing something to create imbalances in the body for a prolonged period of time, then the system in the body gets confused and starts attacking itself. Very bad scenario. Imagine your own guards and army attacking you. Not a good situation, correct? So once you have an autoimmune disease, means things have really gone wrong, right? So that is one important thing to understand, that our immune system is designed to protect our body by responding to invading microorganisms. That is the primary function. Autoimmunity refers to problems with the adaptive or acquired immune system's reactions, where immune cells make a mistake, right? If your army is attacking you, it's a mistake, right? So it is a fundamental, deep, problematic situation and attack the very cells that they are meant to protect, leading to a variety of complex disorders called autoimmune diseases. Now, why is this happening? Dramatic and alarming worldwide increase since World War II, especially after World War II. What happened in World War II? Lot of chemical warfare agents were used. If you look up Agent Orange, Google it, Agent Orange, very deadly, and it did not biodegrade. Soil was poisoned, people were poisoned, right? So lot of things, and also ADs are rising as we are increasing the use of increased production and use of chemicals, both in industries and agriculture. So we are using, and we are also using, in our personal care, like cosmetics or anything that you see. If your fiber is water resistant, it has chemicals. So you're breathing chemicals, you're touching chemicals, your receipt, that shiny receipt that prints out, that is chemical. So everything is chemical that gets into the water, and that's also in your poultry, in your cattle feed, everywhere there are chemicals, especially in the United States. I'm talking about United States. I think Europe is doing still better, but US is worrisome. As per NIH, up to 50 million Americans suffer from an autoimmune disease, which is a very high number. As you can see, cancer affects only 18 million and heart disease about 120 million. So it's somewhere in the middle, right? But you hear a lot of talk about cancer, but do you hear about autoimmune diseases? No. Because autoimmune diseases are like something that is stuck to you. It is not killing you, but it's everyday trouble, everyday problem, right? So budget is not there, attention is not there. That is at a policy level, that is an issue. You see some of the numbers here. I'm going to rush through my slides because time is less. 100 plus autoimmune diseases. And even as we are talking, there are more diseases that are being suspected of having an autoimmune origin. In the past, no, not an autoimmune disease, but now more and more evidence is showing that so many other problems that we thought were not autoimmune diseases actually have an autoimmune origin to them, which means the body is attacking itself. So the disease is not having a different pathological pathway, but our own body has lost its intelligence. In Ayurveda, we call it buddhi. The cellular intelligence is lost, which is a drastic state. It's a SOS situation, right? Now, what are some of the challenges? These set of diseases tend to be chronic in nature, affect the quality of life and productivity, and can be life-threatening. So you are alive, you're going to your job, but you're not feeling 100%. You don't have energy, you have brain fog, vague symptoms. If you tell your doctor, what is brain fog? I don't understand, it's not there in medical books. But patient is experiencing cloudiness in the head, can't focus, can't remember, forget exit, forget keys, right? So these are some of the problems. They are some of the most difficult to recognize. It's like when you see a guard, you think they are your protector. So you can't recognize enemy or protector. So they're difficult to recognize even by medical doctors. Why? Because medical doctors also are not fully educated about what an autoimmune disease can look like. Yeah. And as far as tests are concerned, I will show you in the next slide. They also have a problem, the testing. Symptoms are often hard to describe, right? If you have some like eczema, you can go and say, okay, I have this. Doctor can see. If you just go, I'm feeling off, something is wrong. I don't know what is wrong. No energy, I can't get up in the morning. Sometimes my joints are paining, sometimes I'm forgetting. And doctor will say, go sleep, not a problem. No, you don't have any problem. Get lab tests, all lab tests are okay. Go back. And then you will see in the next slide, a lot of patients are labeled as chronic complainers, literally. This is happening in the medical industry. Too many times you go, 4th, 5th time, you will get a label, chronic complainer. No diagnosis, no help, okay? It takes an average of 5 years and about 4 doctors to actually give you a name for your problem, okay? And these are in multiple systems. They're not in one place, like, okay, only stomach issues going on, right? Okay, you have an inflammatory bowel disease or something. Only heart issues going on. No. Something is happening in the heart, something is happening in the brain, something is happening in the colons. So it's a multi-organ, multi-system disease complex, right? So that also makes it difficult because now the insurance sector forces the doctors to see the patients only for a few minutes. So after 15 minutes, quickly they have to put something. Okay, you can go, right? I don't know, and again, this is for US. I don't know about Europe, but this is more for US, what is happening in United States. And they are not often considered until the disease has progressed to a point where severe classic or hallmark symptoms occur. So for example, for rheumatoid arthritis, what are the hallmark symptoms? That you wake up with rigidity and stiffness first thing in the morning, right? And moving pains in the body. So until and unless you get the hallmark symptoms of that disease, that possibility is not even considered. So these are some of the challenges in diagnosing the autoimmune diseases. Yeah, but the interesting part is that the antibodies are already present, right? For example, for rheumatoid arthritis, it can take 8 to 10 years where the antibody is present, but your symptoms are developing much later. But the Rheumatoid Arthritis Association of America has not included these antibody testing until recently. How sad is that? It's almost criminal, right? Because if you are getting a little clinical picture, all you need to do is a simple blood test and see antibody, okay, this is the predictive diagnosis. You are developing rheumatoid arthritis. You have still not developed fully. You're getting it, picture? So antibodies are present, but they're not included in the diagnostic criteria. ARDA, which is the American Autoimmune Related Disease Association, long name, found that more than half of patients are labeled chronic complainers. I just told you about that. That is so tragic. Specialists are generally unaware of interrelationship between different autoimmune diseases or advances in treatment outside their own specialities, right? Everybody is getting the picture. A heart specialist will not know or will not recognize anything outside of their realm of training. So this intersectional training and awareness is not there because, as I said, most of the autoimmune diseases are multi-organ centric, right? They go across multiple organs and multiple systems. They're not contained in one part of the body. Like I gave the example that the army of the nation is against its own people. You can't say that's happening only in one city. Usually it will be in different pockets of the country. So similarly, in our whole body, different areas are getting involved in autoimmune diseases. And US is behind, as you can see. Now, this is a very important concept. This is the triad of autoimmune diseases. Dr. Alexander Fasano, who is the leading gastroenterologist in the Boston area, he first came up with this triad. And this makes total sense because let's unpack this. One corner of the triad is saying genes, right? Another corner is saying environment. And the third corner is saying gut dysbiosis. Now, genes are not in our hands. We don't get to choose our parents, right? So whatever that genetic disposition, we are not going to discuss that in detail. There is some detail here. But let's talk about the environmental factors. That as a society, as a nation, as a people, we definitely have some control. But again, if you buy a house in a particular area, you do not have control over the quality of air or water or soil in that area. So to a certain extent, it is something you can change, but practically you cannot change, correct? Can we change our environment where we are living? We cannot. We have to breathe that air. We have to drink that water. So that, and then adjuvants such as aluminum hydroxide, which were very common in vaccines and medical silicons, also have known to cause autoimmune diseases. And in hepatitis B vaccine, and this is for anybody who is familiar with microbiology. So this is how molecular mimicry or epitope spreading. So infections can cause autoimmune diseases. Autoimmune diseases can decrease immunity and cause infections. So both can cause each other. So this is a new insight that has been gained into autoimmune diseases, that either the load of infections, this is my time? Woo. Okay. So these are all the problems. Sorry, I thought I was rushing through. But gut dysbiosis looks like this. You must have heard of leaky gut. And I have to rush to the Ayurvedic section. Ahara, Nidra, Brahmacharya. These are the three foundations of Ayurvedic health approach. If these three are good, you are good. And these are the three causes of all categories of diseases. Pragya, Parada, Asat, Mendriyatha, Sayoga, and Kala. These are the some general key factors. Agni, your metabolic state. Ama, state of dosha dhatumala. Depletion of ojas. So again, the list is long. And all of these, adyashan is repetitive eating without giving time for digestion. Atyashan, chronic overeating. Anshan, fasting. Eating of heavy fast foods, GMO, all of these can cause depletion of what we understand as gut microbiome. A lot of speakers have talked about it. So I want to say one thing here. In addition to everything else, in the 21st century, please put stress in capital bold letters as the major problem that nobody is talking about, because stress affects all systems in our body, including our immune system. Now, this is the layered approach.
Thank you very much.
Last slide. Last slide. Nidana Parivarjana Agni, this is the staggered approach in Ayurveda. Okay, sorry. Really, time is less.
Yes, Thank you very much for your presentation, and thank you very much for coming. You can just and our next guest joining us again online is Ms. Nimisha Narendram, Do we have a connection, please? Miss Narendram?
Am I audible, ma'am?
Yes, yes, we can hear you and we can see you. So you can please proceed with your presentation.
A very good afternoon, the distinguished guest and my fellow colleagues. I am Dr. K. Nimisha Narendran, final year MD Scholar, Department of Kaya Chikitsa, Government Ayurveda College, Trivandrum. Today, I am here to share with you, to shed light on the condition that affects the millions of lives worldwide, rheumatoid arthritis. Let's take a step back and reflect on the history of this debilitating disease. In the past, rheumatoid arthritis has been a mysterious ailment, often misunderstood and misdiagnosed. It used to be a silent tormentor, silently wreaking havoc in the joints. In this picture dated back in 1841 to 1919 is of an impressionist painter, Sir Pierre-Auguste Renoir. He was one among the very few patients who were first diagnosed with RA. However, the time has changed and so is our understanding of RA in the past 13 decades. Today, we are armed with advanced diagnostic tools and innovative treatment options. We have made remarkable strides in the management of RA. The disability rate have decreased, but the stark reality remains the same. RA continues to cast its shadow on the lives of millions of people. As per World Health Organization, a staggering 18 million people are living with RA and 13 million of them are experiencing the severity levels. Let's have a look at these graphs. The recent studies analyzing the Bayesian age period cohort analysis, they allow us to disentangle the relationship between the age, time, and other generational factors. From this graph, it is evident that the incident increases right from the 5 years to 54 years, the peak between 50 and 54. Majority of the DALIs are reported in the age of 60 to 69, and also the age standardized incidence rate is going to increase by 18.23% in females and 8.34% in males by 2030, which is very near. So these insights that is provided by this Bayesian APC analysis, they serve as a wake-up call for us to and understand that there is a urgent need to reduce the global burden of RA. Let's understand the etiologies of rheumatoid arthritis. The phase 1 at risk, the genetic and the environmental factors have an interplay and in initiating the autoimmunity propagation onset of the disease. But this occurs very early in life, potentially as early as the prenatal development. The fetal exposure to smoke induces a risk for RA. Infections in the early period of life induces a risk for RA. The transfer of immune cells from the mother to the kid influences the T cell repertoire in the child. The second preclinical stage is where the environmental triggers enters the scene, orchestrating a symphony of complex interactions. The factors like smoking and hormonal changes, increased sodium consumption, increased red meat consumption, low levels of vitamin D, and obesity have emerged as influential players in the onset and propagation of rheumatoid arthritis. Now, the mucosal surfaces, they provide as a sites of amplification for these anti-citrulinated proteins. The dysregulation of citrulination, it plays an important role, important event, and it can occur at any of the mucosal site, may it be lung, gastrointestinal tract, or uroepithelium. And periodontitis is a very common infection that leads to the dysregulation of the citrulination very early in life. In the phase 3, the immune system itself takes up the spotlight. With the prior onset of the disease, the ACPAs undergo the epitope spreading. They activate the main pathway, that is complementary as well as the classical pathway of immune system, induce the osteoclastogenesis. They drive the macrophages to produce more and more tumor necrosis factor. So it is at this stage that the immune system turns into a double-edged sword, both as a protector and perpetrator, unleashing barrage of destructive forces on the delicate synovium. And therefore, rheumatoid arthritis is best characterized as an immune-mediated inflammatory disease that once initiated, even though the putative trigger is removed, feed-forward pathways result in auto-perpetuating process. Now, let's understand the pathogenesis of RA in 4 distinct stages. The firstmost stage, triggering stage, sets the scene. The intricate interplay between the genetic and the environmental factors help in production of the ACPAs, distribution of the ACPAs throughout the body. They activate the major histocompatibility class 2 dependent T cells, which further go and activate the B cells. So this spark or this trigger, it fans the flames of inflammation. It awakens the immune system from the slumber and sets the wheels of rheumatoid arthritis in motion. So once the triggering stage subsides, the maturation stage emerges. Initial maturation occurs in the secondary lymphoid tissues, which are encountered with an antigen, leads to either activation apoptosis or tolerance of the T cells, following which there is a co-stimulation of the cytokines and macrophages. Ladies and gentlemen, let me tell you, these macrophages are the master orchestrators causing major damage in the RA. This animation is also the co-stimulation of cytokines and macrophages. So this stage is like an artist refining their craft. The immune cells evolves and mature into a full-fledged assault on the once harmonious architecture of the joint. The destructive precision, the triggering, the targeting stage, it takes a center play. The unique anatomy of the small joints of the hands and the feet, they impose a high strain on the instability of the joint. The extracellular matrix, along with a crowd of immune cells, they increase the cell adhesion, enhancing the lymph angiogenesis and causing edema. Within the edema, there is increased osteoclastogenesis and increased the synoviocytes, which result in bone resorption and paves the way to the bone deformity. So this is again like the cells and molecules of our own system who were once the guardian of our health, now turn up again the body, ravaging the joints with fury. The synovial membrane, it offers the battle site, scarred by inflammation, pain, and erosion. And finally, the fulminant stage, it arrives like a crescendo in a symphony. The dysregulation in synoviocytes result in hyperplastic synovial membrane, which further perpetuates the destruction of the joints. Now, it is at this stage that RA is at its peak. The symptoms are more pronounced, the deformity is more common, and the impact in daily life is undeniable. So in this concern, it is right to say that the triggering stage, it ignites the flame, the maturation sharpens the immune system, targeting directs the assault, and fulminant stage marks the pinnacle of rheumatoid arthritis. So this disease, which was once a silent whisperer, now roars with full force, overwhelming the body and mind of those affected with rheumatoid arthritis. Now let's have a look of understanding RA from Ayurveda point of view. Vada Shonidam is a Vada Vyadhi Prabheda. It is a Santarpanajanya Vyadhi, and therefore Ama dosha is dominant initially. There is a vicious amalgamation of Vada and Rakta, and that is why it is called Vada Rakta. Mapping the etiologies from Ayurveda point of view, these highlighted nidanas are the key drivers. That is Vidahiyanam, Viruddhanam, Vidhihinam, Swapna Jagara, and Maithunam, that too in the Prayana Sugumara Avastha. That Sugumara can be related to the early incidents by the Bayesian APC analysis, or it can be the factors in the sedentary lifestyles that were related in the preclinical stage of RA. So these successive, that is Ahara, Nidra, and Brahmacharya, are nothing but the uprooting of the Traya Upastambhas, the three pillars of life. Now let's see how the Vidahiyanam has an important role in causing Vada Shonidam. The capsaicinoids are the main source of spicy flavors, and they play a negative role by neurogenic inflammation. They cause irreversible degenerative changes. They trigger the DNA fragmentation and activates the caspase cascade. Also, the Vidhihinam, Nidra, and Brahmacharyam, Nidra, that is sleep and wake cycle once dysregulated, have a direct effect on the dysregulation of the adaptive immune response. Brahmacharya is very much related to the androgen receptors. It also acts directly by immune regulatory genes through DNA binding dependent or independent pathway. So all these are environmental factors. Where is the genetics? Acharya has very diligently mentioned the genetical nidana, papma bihi, karma bihi, not in Vadarakta, but in Kushta. So through the Vada Shonidam Kushta axis, I want to explain that the Nidana Samprapti of Kushta forms a stepping stone of this disease in the stage 1 and preclinical RA. Together with the genetic susceptibility, there occurs a Tiryak Gati of the malas and doshas, which vitiates the Twak, Lasiga, Asrak, Amisham, further vitiating the Sira, Kandara, and Dhamanis. Now, Kushta Samprapti, if it is not intervened at particular time, it becomes Margagami and affects the deeper dhatus and shaka, showcasing itself as Gambhira Vada Shunya. This entire concept is strengthened by the gunas of Shuddha Rakta, as mentioned by Acharya Shushruta in Sutra Sthana. Out of this, Dravatva and Lagutva is of importance in Vada Shonidam. See, when the Rakta is Shuddha, where the pure blood is capable of circulating through the microchannels hazel-free, but once it is infiltrated by the immune cells, it loses the property of Dravatva and Lagutva. It becomes Guru and it deposits in the bare areas. So not only in Ayurveda, but also in the modern people are researching about where there is any common inflammation between the psoriasis, psoriatic arthritis, and rheumatoid arthritis. Next, on the road to manifestation of disease in Vada Shonida, there has to be a prerequisite Rakta Dushti. Rakta has already lost the Dravatva and Saratva. Vada also loses its Saratva and Sukshmatva property, and together there is an Avarana which leads to Dhatukshaya. So to break the chain, we need to administer medicines which are Deepana Pajana, which corrects the Jatharagni, Dhatwagni, which corrects the Avarana, which are Rakta Prasadana. Shodhana has a major role to play in the treatment of Vada Shonida, especially the Virejana and Vasti. Shira Vasti here is concentrated to correct the bare areas to prevent the deformities, and rasayanas to combat the dhatukshaya. Now, to prolong the remission, one has to maintain the balance of trayobastambhas that I mentioned earlier, and the one way to do is to follow the dinacharya and rutucharya, which are the exclusive features of Ayurveda. These are the importance of shodhana. These slokas are taken from Ashtanga Hridaya Sutra Sthana. The highlighted ones are very much in correlation to the importance of gut flora dysbiosis that I also mentioned in my previous presentation. The gut flora dysbiosis correction reinstates the brain homeostasis by blood-brain barrier patch-up. So that is very much related to the buddhi prasadam and mano buddhi prasidati. Activation of the inflammasomes are very much related to the roga haram and balam, and reduction of the lipid peroxidation, activation of the catecholamines are related to kaya agni birvardhati. Another important treatment entity in Vata Shonidam is Siravedham or Rectamokshanam. Several years ago, first line treatment before all others was bloodletting. A shear stress on the endothelial wall as a result of increased blood flow may enhance the angiogenesis. Also, in RA, the microvascular density is significantly higher. Now, this is very much related to the loss of Laghu Guna of the Shuddha Rakta when it becomes Guru and becomes vitiated and deposited at the basement membranes. Now, this MRI image shows a striking association between the presence of bone erosion with increased intra-articular blood flow to the bare area. So, by timely recta mokshana, we can prevent the bones from getting deformed. Rasayanas and Patya was also explained in the previous presentation, although I would like to comment that selection of apt Rasayana, depending on the patient's prakriti and the Amsha Kalpana of the doshas, should be administered post-Shodhana. Only then they will be able to increase the reactive oxygen species and ameliorate the helper T cells. Towards the end of my presentation, I would like to share my dissertation topic, effect of Mundidiga Churna in Vata Rakta with special reference to rheumatoid arthritis. This formulation was taken from Chakradatta in Vata Shonida Chigilsa Adhyaya. The principal drug is Sphaeranthus indicus, belonging to Asteraceae family. Though it is Madhura Rasa, it is Laghu Guna. The plant has a mast cell stabilizing action and is nephroprotective. Another Anupana Dravya is Guduchi, that is Tinospora cordifolia, which is very well-known herb in Ayurveda. It is again Tikta Kashaya and Laghu Guna. So these Laghu Guna of two drugs together helped in fighting the or correcting the vitiated recta, which is having Guru Guna. And we got striking results in change in the anti-CCP titer value. 81.8% of the participants recruited were having titer value more than 500, which reduced to 18.2%. And also there was significant reduction in ESR, RA, and CRP at the end of 30 days. Now I have enlisted the research works in RA and Vata Shonidam conducted at Government Ayurveda College Trivandrum. The important ones have been highlighted over here. Like an evaluation of efficacy of Siraveda in the management Vata Shonidam shows that the bloodletting has a promising result in Vata Shonidam. Study on the effect of Hapusha Dyapanavasti. Now Hapusha is the same drug Mundidiga that I selected. It has a significant reduction in IgG and IgM in the management of rheumatoid arthritis. And again, this randomized control trials to evaluate the efficacy of Shiravasti. Shiravasti is to correct the bone resorption and to prevent the bone from getting deformed. Towards the end, I would like to acknowledge the contribution of modern medicine in improving the quality of life of the patients afflicted with RA. They have got a variety of strategies, right from administering the steroids to the monoclonal antibodies. But I would like to state that the ultimate goal of any system of medicine to reduce in combating RA is to reduce the disease activity by rendering safe medicines and prolong the disease remission of RA, which is not achieved even now. So this is not a rabbit versus turtle race of modern medicine versus complementary medicines. Let us push together our boundaries of understanding RA and forge towards a path of brighter future to combat this debilitating disease. Towards the end, I would like to show the glimpse of this one casual working day at Government Ayurveda College OPD section. And towards the last, I would like to place on record a deep sense of gratitude to my guide, Dr. Ashwati ma'am, who helped me come up with this concept. I'm very much thankful to Dr. Sunil John sir, who helped me with the concept of Vata Shonida and Kushta axis. Lastly, I'm very much thankful to the Institute of Traditional and Complementary Medicine, Czech Republic, for providing this online platform to be able to share this piece of knowledge with all of you. Thank you so much.
Thank you very much, Ms. Narendra. Any questions here in the hall? No? Looks like no. So thank you again, Ms. Narendra, for your presentation. And let me welcome our next guest from Lithuania, Professor Shantala Priyadarshini.
So all of you, a very good morning or good evening or good afternoon, wherever in the world you are looking at this program. So at the outset, I am very grateful to TCIM organizers and the team for allowing me this presentation. And I would also thank University of Latvia, International Leading Studies for having me here, and Government of India, Ministry of Ayush for deputing me here. I would be sharing my views on Ayurveda solutions for global warming, a cultural heritage from the past for the future crisis. And I am very thankful to the previous speakers who have been speaking about environment. So today we need to know, did Ayurveda people know about environment? Were they thinking about the environmental crisis, the climate changes that we speak so much today about? And what were they doing about it and how it was combated? Thank you for giving me this opportunity. Please, I can change my own slides? Okay. Okay, okay. For climate change, it was called as Ritu Viparyaya. That was the Sanskrit term for that. And planet for the future, plastics are playing havoc. So replace, reduce, reuse, beat plastic pollution. But were there plastics then in the Vedic age? No. So environmental safety for health, happiness and prosperity. Sustainable developmental goals was what they were thinking of, pollution of air, water, land and attitude. So what should be the attitude of the people and why? We will go on to it later. One earth, one family, one future. We are all here today on the same planet and we all face the climate change and we need to think of what should be the future and what we can do. From carbon emission to zero emissions, we have to think about because we are doing some things which are wrong. What the people in the ancient days were doing was, they were not using plastic, they were using mud plates, mud cups and terracotta cups, leaf plates, and the utensils they were using was bamboo and these type of things. Then these are the replacements that we have today. Bagasse, sugarcane, biohusk boxes, pineapple box, aracanut box, and we had neem toothbrush, these type of things which are sustainable. But some countries have started it, but not all. Why are we speaking so much about plastic? Is because plastic, 400 million tons of plastic waste and every year, and by 2050 we are going to have 1,100 million tons. It is a huge number. We need to think of it now. And then what happens to this plastic? It goes into the marine land and it starts polluting the whole ocean. So pollution from fertilizers, pesticides, insecticides are adding up to the marine pollution, and pollution made from ships and marine equipment adds to that, and pollution from oil spills, as you all know, pollution from toxic industrial waste and sewage, deep mines, mining, light pollution are destroying the marine flora fauna. So atmospheric emissions is what we need to think, because 100 million animals lose their lives annually. So one pollution, ocean pollution is have negative impact. Then we have Indian way of thinking. What is this Indian way of thinking? Or Ayurveda way of thinking is silver, brass, copper, bronze vessels replaced plastic. As you can see, where all plastic is being used today, there were metallic things that were being used, or as I told you in the previous slides, what was used. Then we have one world, one health. So yes to meditation and no to medication. Vasudhaiva Kutumbakam. Practice yama niyama. Not only yogasanas, not only the from the 8 Ashtanga, ahimsa, be truthful in deeds, words and thoughts, and then we have to have mastery, aparigraha, non-accumulation. Accumulation is causing a lot of climate change, so we need to think of that. Positive attitude for global welfare. Then we come to a very important slide, that is where most meat is being eaten and least. As you can see, the map shows a lot and speaks more about it. So can we do something about it? Fasting has been a traditional way in India. Ekadasi, once in 15 days, we do fasting, not only for religious purpose, but also for climate change. And then meat is not consumed by almost 80% of Indians. It is maybe once a week or once in 15 days, or it could be like few months in a year. So Monday, Thursday, there are specific days when people don't eat meat. So meat in excess is not the way to go for climate change. We need to think of that. And then we have more than 60 countries around the world doing Agnihotra. It is a Vedic tradition of doing fire sacrifice. You can see in this who are all doing. So benefits of Agnihotra is it yields higher agriculture produce and helps the soil fertility. Mental disorders can be controlled in significant number. Repair the ozone layer, which is very important for us now. It checks the radiation of the globally it is air pollution is controlled. We have chemical, physiological, biological, and all these are treated. It heals the atmosphere. Then why silver is extensively used in India is because silver is free from PBA and phthalates, and silver jewelry maintains brain power and body temperature. It is durable, biodegradable, and non-toxic. So you have tongue scraper to feeding the baby and so many things. Then we have something wherein it was very much used, amulets, which later on became a superstition. People changed it and made it into that, and then they put in mantra into papers. So penalties for water, air, land pollution was there. People were penalized for doing wrong to the society. We had sacred forests, 14,000 we still have. Deforestation had penalties. Then we also need to think of the Swedish model of forestry, which EU nations are all looking at. So we in India have special trees for environment. That is what Ayurveda also recommends. Peepal tree, banyan tree, neem tree. It's not only medicinal, but it has influence on the environment. So zero emission building is, I will be showing some photos. It says that it is eco-friendly, no air conditioning is needed. See, these are the buildings which are no transportation is needed of the building material. So you have mud and bamboo, you have cow dung cakes, bricks made out of these houses, and then you have a rock temple. Most of the temples are made of rock, and there is no need to transport material. And here in the last picture you have a step well, which is not only for water transport, but it is also it will be eco-friendly, air conditioning in all seasons. And these are some daily rituals which are being done to save temperature. They have their own kitchen garden. Fruits and vegetables are grown, so no transportation, no packing again with plastic. And then they have tulsi in every house. They have this rangoli, the cow dung water is sprinkled all over the ground, and that is going, if you will go and check Robisco, you will know that this was what was the reason why it was done. Then every small action to save the planet. Eat on banana leaf or drink in silver cups or glass or terracotta. Today we have been seeing that glass cups are being used, and we didn't have any non-vegetarian. Same as in GCTM, Vedic plaster or rock building material, silver or metal utensils for all occasions. Swedish model I have been talking about is 380 million trees are annually planted, which is a huge number, and 980 million tons carbon emission is prevented. So people name, we could adopt this for Ayurveda also, so we don't have biodiversity, loss of species biodiversity. and then Agnihotra to be done globally for healing the atmosphere. Indian homes, cow dung sprinkle aids carbon fixation, increase groundwater level. We do not try not to waste water. Plant a tulsi, make kitchen garden, grow vegetables, fruits. Reduction in meat consumption saves Mother Earth. One Earth, one family, one future. So we speak about a lot in Ayurveda about microcosm and macrocosm, yata pindandam tata brahmandam. So let us save our planet. It is our ideal to do good to the society, so it comes back. So what we do is something which everyone needs to think about, and here I would like to take some questions if anybody has a question.
So any questions from the audience?
Oh, everybody is not listening to me, or? All right.
Thank you so much, Professor Shantala. It's very amazing, and I find it everything that you say can go so deep down. So can you please tell us a little bit more about the silver and that you use for the navel when you at the birth?
Yes,
please.
That's a very good question. It was very good. In ancient days, the deliveries were conducted at homes, and dais are the there were not doctors, midwives were conducting this, and when they were doing it, the umbilical blood was stored into small silver bottles, and that was known as lockets or taita, that was called that. Lockets or amulets. So then they would close it, and it would belong to one person only. It would not be transported anywhere, it would not belong to anybody else. And if that child fell sick, that medicine was used. So what today we know as the stem cell, the banking, so that was there and that was conducted. So that was there, and we find some research articles showing that. Thank you so much. Any more questions?
I think silver is also antimicrobial.
Yes,
so
yes.
I think
yes.
kids should be protected from any infections.
Definitely,
just an additional
definitely.
protection for them, I think.
Everybody has been using silver for tongue cleaner, and they giving medicines to wearing on the jewelry, all that. So it had a lot of meaning, and plates were in silver, so that was good. Thank you very much for giving me.
One more question.
Yes, sir.
Thank you for a very nice presentation.
Thank you.
And I have one question. One way of the thinking is that the climatic change is also because we are too many people here on the earth.
Exactly.
Is there any thinking in India, in Ayurveda, that we should a little bit reduce the number of children to help the planet?
Yes.
Because actually, India has a very many people. It will be the biggest country in the world.
Yes, it is true. Actually, in India, we had a thing as to when a child should be born, at what age the marriage should take place, and what time they should copulate, and when the child should be born. So they had a lot of things. But later on, what happened? We had too many different states, we had a lot of invasions being done. So we had the influence of the British, the Mughals, and so many other countries. So the whole culture was lost. We had all this very previously. We had it previously, but we lost all that, unfortunately. We need to bring it back. Thank you for such a good question. I agree.
Thank you.
We are a very loving country.
Sir.
Okay, so
one question.
I'm sorry, unfortunately.
One question.
We are short on time.
Just one.
Anyway, thank you very much. It was an excellent, presentation, and it gives answers to many questions of what the world is looking forward. and my question is more of an answer to you, that please continue such a way. And as far as India is concerned, I would just simply say that what the West is making use of carbon, that way India is nothing in comparison. It is true, the population of India is much more, but it is hardly what America, what the West, and the plastic and the other things, and the pollution of the ocean. It is huge on behalf of so-called, developed countries.
Thank you so much, sir. You have added a lot for my presentation. Thank you.
Thank you very much. We are very honored that you came here. And our next guest will be joining us online, and it's Mr. Mohammad Motewali. So do we have a connection? Can you hear us, Mr. Motewali?
Yes, can you hear?
Yes, we can hear and we can see you. So you can please proceed with your presentation.
Good. Do I need to share my screen or it's already done?
Yes, please share your screen. Okay, we can see your screen now.
Yeah. So, hello, ladies and gentlemen. Thank you for having me today. My name is Mohammad Motewali from University of Innsbruck, Austria. The study that I am presenting today is a part of an Austrian-wide project called From Science to High School and University that focuses on healthy and sustainable lifestyle behaviors of young adults, with a particular emphasis on diet type. The title of my presentation is Lifestyle Behaviors of Vegans, Vegetarians, and Omnivores in Austrian College and University. So as you can see, the main focus is comparison between vegans, vegetarians, and omnivores. As you know, health is the greatest wealth, and no one can ignore the importance of a healthy lifestyle in almost all aspects and details of life. Evidence shows that 38% of our health is affected by our behavior, while medical care contributes only 11% to our health. Despite these facts, unfortunately, the money that people and governments spend on medical care is much more than health behavior. These data clearly shows that prevention is much more important than treatment in medical issues. According to the American College of Lifestyle Medicine, there are 6 areas of lifestyle, including physical activity, diet, substance abuse, sleep, relationships, and stress. The World Health Organization reports that lifestyle behaviors play a significant role in the prevalence of non-communicable disease. These diseases are the main cause of 74% of all deaths globally. And the problem is much more critical in low and middle income countries. The bad news is the prevalence of non-communicable diseases is increasing worldwide. And for example, the prevalence of obesity has nearly tripled during the 50 years ago. But the good news is that the non-communicable diseases and the associated risk factors, such as obesity, are preventable and even reversible. A European-wide study reports that only 6% of European people have a healthy lifestyle. In this study, there were 5 criteria to define a healthy lifestyle. 1, meeting the recommended level of physical activity. 2, acceptable intake of fruits and vegetables, 3, no smoking, 4, low alcohol intake, and 5, good quality of sleep. So as you can see, this is not a fully healthy lifestyle, but an acceptable healthy lifestyle. And when we compare different countries across Europe, we see that Austria has not a good situation, and only about less than 3% of Austrian people have a healthy lifestyle. If we focus on the component of lifestyle, first we can start with physical activity. This physical activity is one of the most important area of lifestyle, and WHO recommends that adults should engage in weekly amount of physical activity by about 150 minutes per week. That is better to be distributed in 3 different days. And in Austria, data shows that people have an acceptable level of physical activity, and 75% of adults in Austria meet the PA or physical activity recommendations. And as evidence shows, to maximize health benefits, it's better to combine physical activity with a healthy diet. The next part is healthy diet. That is very important also for sustainable lifestyle and health. Evidence shows that vegetarian and vegan diets are recognized as one of the most appropriate dietary strategies that people can follow to have a healthy diet and nutrition. And the prevalence of vegan and vegetarian diet in Europe has been estimated about 10% with an increasing trend. And again, to maximize health benefits, it's better to combine healthy diet with other lifestyle components like physical activity. And regarding substance abuse, data shows that smoking accounts for about 8.5 million deaths everywhere globally. And this number for alcohol intake is about 1.5 million. About more than 20 types of disease and injuries worldwide are linked to substance abuse. And this problem is much more critical than adults and also in men compared to women. The target population of this study are students and academic staff of Austrian colleges and university. And there are some reasons that we decided to choose this population. University life is crucial in shaping and developing health behaviors. And university life is linked to sedentary nature. And most of people, students and academic staff, have sedentary nature. And also psychological distress is very popular among this population. And data show that only 50% or half of university population meet the physical activity recommendations. And also the prevalence of unbalanced diet is higher than normal populations. And this directs us to go to the aim of this study. And this study aimed to investigate lifestyle behaviors of participants based on dietary groups. And in follow, we analyze potential associations with PA or physical activity behaviors, as well as socio-demographic characteristics. We use cross-sectional design as a study design, and we conducted an online survey to do that. This study was nationwide, and in Austria we have 102 university and colleges, and more than half of this number participated in this study, and more than 6,000 students and more than 1,000 academic staff participated this study, and we collected data in 2021. a comprehensive profile of data on social demography, anthropometry, and academic status, as well as lifestyle behaviors were measured. And all data were compared based on different diet types in 3 categories: omnivores, vegetarian, and vegan. And we use different types of statistical methods to analyze the data. In the sample of students, there were 65% females, and the prevalence of vegan and vegetarian diet was totally about 28 or 29%. That was much more higher than the normal population. And the prevalence of overweight and obesity was about 80% in the sample of students. In the sample of academic staff, the prevalence of vegan and vegetarian diet was a little bit less than students, but still higher than normal population. It was about 50%, and about 32% of participants or university professors were overweight or obese. In the sample of students, as you can see here, the prevalence of vegetarian and vegan diet was was higher in females than males, and also in graduate students than bachelor students. And also participants or students living in the urban area has a higher prevalence of vegan and vegetarian diets. But there were no significant associations in terms of nationality. In the sample of academic staff, significantly females had a higher prevalence of vegetarian and vegan diet. And also professors from out of Austria, but working in Austria, had a higher prevalence of vegan and vegetarian diets compared to Austrian professors. And no significant difference was found in employment status and also living environment in terms of urban or rural living. In the sample of students, there were significant difference in BMI values. As you can see here, participants with omnivores or mixed diet has a higher BMI, and in the sample of academic staff, also this data, we saw this data, and participants with mixed diet has a higher prevalence, has a higher BMI values. In the sample of students, here you can see vegetarian and vegan participants or vegetarian or vegan students has a higher rate of engagement in leisure time sports participation, and also vegan and vegetarian students has a lower alcohol intake compared to those who follow mixed diets. But no significant difference between dietary groups were observed in the smoking and club sports participation. In the sample of academic staff, again, vegetarian participants had a higher engagement in physical activity. And here you can see also in alcohol intake, those who follow vegetarian and vegan diet has a lower intake of alcohol compared to omnivorous professors. And interestingly, here you can see in smoking, there were no vegan participants who has a smoking behavior. And no significant difference was observed in club sports participation. If we want to summarize the key findings, we can say the prevalence of vegan and vegetarian diet was about 30% among students and 50% among academic staff. And females were more likely to be vegan and vegetarian in both samples, students and academic staff. Among students, vegan and vegetarian participants were more likely to participate regularly in leisure time physical activity. However, in the sample of academic staff, only vegetarians were shown to have a more engagement in physical activity. And participants with vegan and vegetarian diet in both groups had a lower prevalence of overweight and obesity. And in the sample of the students, no significant difference between the smoking behaviors was found. But among academic staff, vegan participants had a lower smoking rate than vegetarian and omnivores. And regarding alcohol, a lower alcohol intake was observed among vegetarians and vegans compared to omnivores in both students and academic staff. And fluid intake was more prevalent among vegans compared to vegetarians and omnivores in both students and academic staff. If we want to conclude this data, we can say that vegans and vegetarians had a healthier lifestyle compared to those who follow mixed diet. And in the sample of students, there were acceptable healthy behaviors compared to general population. These data we found this data again in academic staff compared to Austrian adults. They have a healthier lifestyle. And generally, we can say that diet type can influence other health behaviors, including physical activity habits. And this shows that the lifestyle habits are interconnectedly integrated, and they can have a cumulative effect. And this the study protocol of this study has already been published, and there are two separate publications that we just published in the journal Frontiers in Public Health, separately for students and academic staff. And thank you for your attention. We had also the two other presentations, one already done and another is coming regarding this project that we are conducting in Austria. Thank you so much.
Thank you. Thank you, Mr. Montevalli, for your presentation. And to introduce our next guest, I give word over to Dr. Regina from Argentina.
Hi, everyone. Thank you for having us today. I'm Regina Andrade, and together with Carlos Orozco, we'll be presenting Love Expressed as Coherence in Consciousness. When the soul, thoughts, and actions harmoniously converge, a profound sense of harmony and coherence springs forth in our consciousness. This state of alignment resembles the way cycles harmonize, waves synchronize, and shapes take form. In this presentation, we delve into the intriguing concept of love expressed as coherence in consciousness. Well, at its core, the word coherence finds its roots in the Latin word cohere, which signifies the act of sticking together. In the realm of physics, this term is meticulously defined as the property of waves, like light and sound, achieving synchronization by maintaining an unchanging relationship between their respective cycles. This fundamental notion is the bedrock upon which we have built our understanding. However, coherence is not bound solely to the domain of physics. Its influence extends into the intricate interplay between our thoughts and actions, much like a skilled sculptor molding clay into an exquisite form. As these elements come together, life assumes shape and meaning emerges. It is this dynamic synergy, this sticking together of energy, matter, and information that constitutes the essence of our existence. Remarkably, this dynamic process mirrors the profound interplay between energy and matter, echoing the principles of the morphic quantum field. Here, we begin to see the emergence of a fascinating connection. A seed is a tiny but mighty quantum morphic field, connecting us to the very essence of existence, almost like a divine spark. They are the perfect example to how matter and energy collaborate to give life its form and meaning. Now, let us introduce the concept of love into the tapestry of coherence and understanding. The intertwining of love with coherence is not merely a matter of chance, but a divine inspiration. Carlos has invented a transducer, a key guided by divine inspiration that harmoniously combines these intricate elements. This key amalgamates information, a concept representing the ongoing process of formation, shaping, and structuring, and provides interpretation and comprehension to the energy bestowed upon us by God and the energy that permeates our world. The result is our human paradigm of understanding, a unique lens through which we perceive the multiverse. Within this lens, the notion that love is God and God is love takes on a profound significance. Love, as the very embodiment of God, represents the pinnacle of coherence. It is a force that operates within the cyclic nature of existence, where each cycle inherently embodies coherence. To love God is to dwell in a state of perfect harmony and coherence, where the cycle of love becomes a reciprocal exchange, giving and receiving love, creating a profound interconnected flow that reflects the very essence of divine love and the coherence of our existence. This fusion of elements, shapes, colors, numbers, and seeds, provides us with the capacity to comprehend the flow of energy in the multiverse around us. Through this understanding, we can live, sleep, and pray while remaining connected to the energetic flows gifted to us by the Creator. In essence, this presentation is a journey into the profound interplay of love and coherence, where unity and harmony are not abstract ideals, but tangible threads woven into the very fabric of our existence. Through Carlos's inspired creation, we glimpse a deeper understanding of the divine energy that surrounds us and guides our path to living and loving in harmony with the multiverse.
Thank you so much for sharing all this wonderful, Regina. My name is Carlos Orozco, and we're here to talk about love expressed as coherence in consciousness. In the beginning, God created the heavens and the earth. This real beginning is, in fact, an endless path. And we talk about the beginning and the end as the Alpha and the Omega. The earth was without form and void at the beginning, and darkness was over the face of the deep. And the Spirit of God was hovering over the face of the waters. And God said, "Let there be light," and there was light. God used physics in order to allow us to see and enjoy the wonderful world of color, which is nothing else but the mix of the whole spectrum that goes from the ultraviolet to the infrared, ranging from 390 nanometers to 700 nanometers. And this is known as the visible spectrum. And this is what we can see out of the world that we live in. The world of color is amazing because it allows us to form quantum fields. The word quantum simply means quantity, and therefore we can actually see how it forms, as Regina just said in her introduction, as a blend of color that shapes into wonderful figures that are represented here by what we call the seed of life, the beginning of beginning. Everything begins with a seed. So here we got a cuboidal geometry that is expressed by the geometrical figure of a hexagon. But if you look carefully, this hexagon is not really a hexagon, it is a cube. And by becoming a cube, it's a three-dimensional structure that allows us to see how the energy flows. The seed starts with position 7, because God created the heavens and the earth, but soon after, he separated the waters from the heavens, and they call the waters oceans, and the heavens the sky. And not only that, we can actually see that after that happened, the clock began to tick. In position 7, we got that amazing opportunity to see the relevance of number 7, 7 days of creation, 7 chakras in the body, 7 notes in music. All this is because of the clock that is ticking second by second. And then as it does, it blends into the different sides of the spectrum. We started with the red, and now we follow by the orange. The orange is followed by the yellow. and the yellow is followed by the green. And here we stop because you can actually see the amazing thing about nature and God himself. Have a look at the world around you and see how many things you see in red. The first one comes to mind is the pigment called hemoglobin, which is red. This is what gives our blood that color that is distinctive from many others, the red color. And then we got the green. And the green color is found in nature, in every single leaf, in every single bush, in every single forest, in every single vegetable that is around us. Then we follow with the blue from the sky that we see. That is not blue, but it allows us to see blue because this is a blend of colors that is making that color blue defined in such a way that now comes the indigo. And the indigo completes, no. I'm sorry. The indigo completes the star of the show, which is the star of life. And this color blends together and starts spinning, and it spins, blends all the colors into one color, which is the purple. And with this, we form what we call an octet. If you have a look at the number of hexagons that you got there, you got 7 hexagons, finishing with a full color, which is the purple, defining that. And the color purple is the addition of all the colors. And the one that is missing is the purple. And because the color purple is missing, that's what you see reflected by the light that shines above us. So here is a summary of what we call coherence. Coherence is basically represented by the flow of energy that works efficiently. Efficiency is one of the attributes of energy and matter and information, because every system works with efficient, allowing for the expression of energy to form shapes, and these shapes basically move into alternative steps where we can go from the red all the way to the purple, and from the purple all the way back to the red, passing from all of the colors that are in between. This defines the fact that we have coherence and congruency working together. Congruency is a sequence that follows and precedes coherence. The 7 hexagons basically represent and are established in the rainbow. Why? Because the rainbow comes after the storm, and the storm in our lives sometimes happens in the most amazing ways, where we got desperation, frustration, humiliation, depression, etc. And yet we come on the other side radiant. There is always sun after the storm. And what this happens is in creation, which is the manifestation of God's in nature. We can see the blend of the colors following this beautiful, beautiful scenery that you can see before you. And to do all this, we got a key to coherence, as I called it many years ago. And this is basically a transducer. A transducer is something that exchanges energy, information, and matter, and allows for congruency and coherence to come together in order to shape something based off our intention to succeed, our intention to do something, our intention to achieve, our intention to dream, our intention to follow our dreams and make them come true, and as they shaped into the reality that we're living. Here we got the diagram that shows how this happens. This has a lot of detail, and I won't go into that. All I want you to know is that there is a flow of energy that happens continuously, and this forms vortices, and the vortices are allowing energy to be transferred. And we got the Coriolis effect as an example of this. The Coriolis effect is that we see in the northern and the southern hemisphere. And this is what allows the opposites to attract, because at the moment we are in Australia, and here we got a wonderful summer about to start because we just finished winter. In the northern hemisphere, it's exactly the opposite. I have lived in Europe before, and of course I know what it's like to be at -20, -30 degrees when I was in Sweden with my sister and her family. And also, I also been in Saudi Arabia, so I know what these colors and the heat that the prince brings out, the essence of love and life in our life, becomes a vortex. And this vortex, or vortices allow for the expression of God's eternal, omnipotent and omnipresent and omniscient wisdom that basically reigns in a place called Earth where we live. So God is love. That's a definition found in the Bible in this particular verse. And then we know that God is light. And by doing that, we can see beyond our dreams. We can see beyond the light. Through what? Through God's love. And this is something that we can see thanks to the effect of melanin in the atmosphere and the world that we live in. Melanin is a pigment that allows the skin to have a particular color. It shapes our eyebrows, our eyelashes. It also shapes and shades our color. Naturally speaking, the color of the skin is basically based on the amount of melanin. And Dr. Arturo, who is a very close friend, Dr. Arturo Solis Herrera, is a scientist from Mexico, and I got the privilege of knowing him as my friend now. And we are now looking into Arturo becoming a potential Nobel Prize in the world of not only ophthalmology, which is his specialty, but also in the world of science, such as physics, quantum mechanics, and of course, spectroscopy. So with this, take your heart and give it to people. Keep your heart to God, because he gave it to you to live. Every single sound that you produce inside of you is the resonance of God's love in yourself. So God gave us his only begotten Son, that whoever believes in him will have the privilege of having eternal life. And we are all called to have this amazing thing blending with energy and colors so that we can shape and fulfill our destiny. So take care of your thoughts, because they become your words. Take care of your words, because they become your actions. Take care of your actions, because they will become your habits. And take care of your habits, because they are forming and blending your character. And take care of your character, because it really becomes your destiny. So make the most out of every day. Allow energy to flow from the heart, and then share it with the world around you. Because from the richness of the mouth, the heart speaks. Or from the richness of the heart, the mouth speaks. Is reciprocal. So thank you very much for sharing this with us. And this is a pleasure to be with all of you. I just wish you, with Regina and the rest of our team, a beautiful, beautiful, amazing afternoon. Keep on enjoying this amazing conference.
If there are some questions in the audience? No, looks like not. So thank you again, Dr. Andrade and Dr. Orozco. Thank you very much. What follows now is a short coffee break, and we will meet here again at 5 p.m., please. Thank you. So, welcome back from coffee break. I will now present Dr. Alexandros Tilikidis from Greece. That's your microphone.
Hello, everybody. I would like to, first of all, to thank Mrs. Maria Leonie Georgopoulou, who is together with us now, and she is the one that invited me and introduced me to this Congress. I would like also to thank and congratulate Dr. Thomas Pfeiffer for his efforts in organizing this Congress. I have some information about me. I will say some few words about the necessity of the revival of traditional medical systems. I practice medicine since 1991, 32 years of experience as a Western medical doctor till 2001, and from 2001 and then as a acupuncturist, traditional Chinese medicine doctor, involving also with herbs. And later, when I realized the similarities between traditional Chinese medicine and traditional Hellenic medicine and Hippocrates, I started gradually to study Hippocrates and to use the Hippocratic ideas in my practice. So first, as a Greek medical doctor, I became a Western medical doctor, and then because I was disappointed with this practice, I went to China and I started to practice acupuncture. And then after all this traveling around the world and around the time, I realized that in my country, in Greece, there is Hippocrates, and he is very important and and we have to study him and read him again. After 30 years of practice, I realized that the modern Western biochemical medicine, this is what we can say the modern medicine, is very harmful and dangerous for the health and the lives of people. It is very clear to me that today people don't die anymore of natural causes, but the majority of people, especially in the Western countries, Europe and United States, die because of medical causes. This is the reality. This is what happens today in our world. The medical doctors kill their patients with vaccines, medical drugs, operations, wrong consultations, ignorance about the importance of diet, and so on. All their medical practice is a great mistake. On the other hand, of course, the majority of the patients believe the exact opposite. They believe that the medical doctors are doing their job very well and that they are saving lives. But we know that this is a lie. And this lie is propagated from the television. That's why they simply believe in it. The modern medicine and medical doctors are strongly influenced by the pharmaceutical companies. The pharmaceutical companies make the rules of financial profit, and the medical doctors, unfortunately, like pawns, follow these killing rules. So what will happen? Is this the end of medicine? Are we going to see the termination of medical history in our days? What are we going to do? The answer is that we are going to search for a new path in medicine. This is what we have to do. All of us that remain clear, and I want to say this, that I felt, because all we are involving in this work with patients, we feel energy, and this is what I felt in this place, that the energy of the people is clear energy. So all of us that we remain clear from the killing influence of pharmaceutical companies, we have to search for a new path in medicine. According to my opinion, this path is the traditional medical knowledge and practice from everywhere in the world. From China, traditional Chinese medicine, acupuncture, Chinese herbs, Tai Chi, etc. From India, Ayurveda, yoga, etc. From Tibet, traditional Tibetan medicine, Tibetan herbs. From Middle East, Unani Tib medicine and traditional Persian medicine. From Greece, traditional Hellenic medicine. From Europe, traditional European medicine and naturopathy, and so on. All of us that study and practice any kind of traditional medicine, we need to be united. Acupuncturists, herbalists, Ayurveda doctors, naturopathists, etc. We don't have the luxury or the time to focus on our differences. We only have one way if we want to survive in this rapidly changing world, and this way is to be united and to focus on the similarities and commonalities among the different traditional medical systems that we practice around the world. This union is very important if we want to create a new path in the history of medicine. This is my opinion, this is my message, and this is the reason I came to this Congress. So now I will start the presentation of traditional Hellenic medicine. The beginning of traditional Hellenic medicine is, we can find in the Greek myths about the gods. So the god of medicine is Apollo. Apollo is the god of light. So the first message from the Greek mythology is that the most important healing power in the practice of medicine is the sunlight. We have to remember this, that the sunlight has inside a very strong healing power, and we have to use this healing power. This is the first message from traditional Hellenic medicine. Sunlight and the importance in as a healing tool. The other, the god Apollo. I have to say something very important in this point, that the image of Buddha, which was created about 200 before Christ, it is image of the god Apollo. Because when Alexander the Great went to India and had the contact with the Indian philosophers, and they say, the Indian, that, oh, you the Greeks, you have very nice statues. How can we give a face to our Buddha? And the answer was that Buddha is the enlightenment, is the god of light, so Apollo is the similar in Greece. So we have to know that the Buddha images are coming from the god Apollo. So big and important is god Apollo in the history, not only of medicine, but also of culture and religion. God Apollo, as all of the Greek gods, had a lot of sons and a lot of daughters. Some of the daughters, again one information, very important, of God Apollo are medicine, music and oracle. These are the daughters of God Apollo. Music, medicine and prophecy, when somebody can say something about the future. So these three things are in relation between them. The other son of god Apollo is the god, the semi-god Asclepios. Asclepios is the god of medicine in the Greek mythology. He is a son of god Apollo with a woman that she was a mortal woman. God Apollo is immortal, and his wife Coronis, from which Apollo had a son, Asclepios, is a mortal woman. So Asclepios, who is the god of medicine, is a semi-god, so he can die. The important and the message from the traditional Hellenic medicine in this case is how Asclepios, the god of medicine, died, because he died. How he died. And this is a very important message for us, for the healers and for the medical doctors and for the therapists. He died because he was punished from Zeus. Zeus is the father of gods. He is the first god. With the thunder, he killed him. So the first medical doctor in the history of medicine for Greek is killed by his grandfather, by Zeus. Why happened this? Because he revived a dead man. So there was a protest from the underworld god Hades to Zeus that this Asclepius is causing imbalance in the equilibrium between the embodied and the ethereal souls. So he has to be punished. What is the message for medical doctors? The message is that medicine must not involve in the situation of life or death of a person. We have to respect that we are not gods, we are humans, and we have to arrive till this border. If we do the hybris to pass this border, then we will be punished by the gods. Another very important message from the ancient Greek Hellenic mythology. The death of Asclepius. Then we have the Asclepia, where the hospitals of the ancient Greek people. Then we have Hippocrates. Hippocrates is after 18th generation a son of Asclepius. Asclepius had mainly two sons, but also many others, as all the Greek gods. The two sons were Machaon, who was the surgeon, and if we try to see the etymology, Machaon is the surgeon, is the person that acts with his hand on the human body. So one Machaon, and the other is Podalirios, the other son of Asclepius. And Hippocrates comes from Podalirios. What is Podalirios? What is the meaning? Because all the words in Greece have a meaning. Podalirios is the one that has his legs in the herbs, in the lyria, in the lilium, in the flowers. And he is the pathologist. Machaon is the surgeon, and Podalirios is the pathologist. He is the one that treats with herbs. So we can see this difference between the two kinds of medicine, the difference between the surgeon and the philosopher doctor. So Hippocrates comes from Podalirios. He is a pathologist. He is a philosopher doctor. What is the medical background of Hippocrates? Hippocrates, his grandfather and his father were priests in the Asclepion of Kos in Greece. Asclepia, as I told you, were the ancient Greek hospitals. So they were priests, his grandfather and his father in Asclepion of Kos. So one part of the medical background of Hippocrates is, we can say, a part that is related with religion. The other part of the medical background of Hippocrates is that he was a student of many philosophers, like Democritus, like Pythagoras, like Anaximenes, Anaximandros, Heraclitus, Thales. We have the... So,
you now have 1 minute left,
okay.
Please.
At that time, we have the flourish of medical schools in ancient Greek, from 550 with Pythagoras till 500 after Deus, where the Byzantine emperors stop this, and I finish with this, stop all the Greek civilization. They stop the theater, they stop the Olympic Games, they stop the medical schools, the philosophical schools, they disappear everything Greek. That's why now Greek philosophy, Greek medicine is so ignored by the whole world, because there were a very violent stop in the continuation of traditional Hellenic medicine. This is my try now, and many other people in my country, to make, to establish a continuation in this long time history. And if I have time, little time, okay, I have to say, did I finish? Okay. I have to say that all of us, like me, we met with traditional medicine through the philosophical ideas of India and China, or from the East, because in these countries they kept their tradition. But we remain European. And all this philosophy, it's a little bit mysterious and strange to us. If we want to know better, to do the job of traditional healer, we have to know better our European tradition. And one part of this European tradition is Hippocrates and his books. This is my message to you. Thank you very much for your attendance.
Thank you very much, Dr. Kalidikis. We are delighted you could have joined us, and we thank you for your presentation. And I will invite our next guest, Mr. Derek Artanus. Here's your microphone, and you can use this to switch between slides in your presentation.
And there's a pointer as well?
Yes, the
middle one?
Yes.
Hello. So, yes. Hello, everyone. Good evening, and thank you so much for having me. My name is Derek Tanis, and I have a Master's of Science, what I actually got at the University of Rome in Italy. But I'm actually from the US, and I'm born and raised in Maine. And I'm currently doing my PhD in Austria at the Department of Sports Science in Innsbruck. And my supervisor is Dr. Katerina Wierniczer. She is the principal investigator of the NERMI study. And so today we're going to be looking at a very special investigation from the NERMI study with a very health-conscious active population. So I'm involved in some different projects. The first one is where my PhD is entrenched. This one's called From Science to School, and it's the first study to look at the prevalence of vegan and non-vegan diets among pupils in the school setting and make the connection between different health behaviors. So I'm also involved as a research assistant for the follow-up study, and that one's looking at the health behavior of academic students and staff at universities and colleges. So I'm a part of the Good Health Retrospective Study, which is looking at the micronutrient status among the Austrian population, and the NERMI study, which is the main focus of today, where we're going to be looking at recreational distance runners and the connection of different diet types. So here's the outline of my talk. First of all, we need to talk a bit about diet, so we have a mutual understanding of what diet is. And then we're going to look at diet today, followed by the methods and results of the NERMI study. And then we'll have some discussion and conclusion. So first of all, what is diet exactly? Well, I think it could be a couple of different things. So first of all, it's just all the food and drink that one consumes. And we can pretty much see this in the energy balance model here on the left side. But diet could also be another thing, and that's where somebody restricts caloric intake. And in that case, the major goal is to lose body weight without actually making any changes in energy expenditure. Now, I want to be clear that I'm not recommending this as a healthy or sustainable way to reduce one's body weight, and the main focus I'm talking about is number one. So here we have some different eating patterns. And so most of us are guilty today of eating the seafood diet. We see food and we eat it. But here we can see there's two general types of omnivorous diets. And these diets don't have any scientific consensus for a rigorous definition. So the best definition for the flexitarian diet is somebody who usually eats vegetarian, but occasionally consumes meat. Now the four diets below this line, these have very strict, rigid scientific definitions. The first three are the general vegetarian diets, and the last one is also a vegetarian diet, but this one is very special, and that's because it contains no animal products whatsoever and is composed of 100% plant-based nutrition. So then we have diet today. So all across the world, there's about 7% of the global population eating a vegetarian diet, about 2% eating vegan, and the overwhelming majority of the world's population eats some type of omnivorous diet. What's really interesting is the skyrocketing that's going on with the vegan diet prevalence. So we can see just in the US alone, this has increased drastically in recent years. So why is it that people follow more and more plant-based dietary patterns all the way up to a vegan pattern? Well, there's many different things that drive a person's behavior. And we can see here in the COM-B model that capabilities that a person has, so all of the physical and psychological resources they have, may influence behavior. But also the physical and social environment that lead to the opportunities that people have may also drive a person's behavior. But motivation may overpower both of these things. And we can see the top motives for following a plant-based diet: animal welfare, health purposes, environmentally friendly. So these can be so powerful that they can influence behavior. So all this time I've been talking about more and more restrictive dietary patterns. But is it even safe to consume a plant-based diet? So here we have the position of the world's largest nutritional organization, the Academy of Nutrition and Dietetics. And here's what they say about vegetarian, vegan diets: that when these diets are appropriately planned, they can be healthful, nutritionally adequate, and may even provide health benefits in the prevention and treatment of certain diseases. So the key term there is appropriately planned. So the next sentence goes on to say that these diets can be eaten at all stages of the life cycle: during pregnancy, during lactation, infancy, childhood, adolescence, older adulthood, and also for athletes. For athletes. What about protein? Well, we're going to look at that a bit with the NERMI study. So here we have the methods of the NERMI study. This is Europe's largest study on runners, and it's the first study to look at the prevalence of vegetarians and vegans in endurance running events, and to make the connection between diet type and physical performance of half marathoners and marathoners all around the world. So this is an interdisciplinary study containing specialists in nutrition science, sports science, doctors of sports medicine. It's cross-sectional based on different surveys, has been conducted in 3 steps since 2015. So here we have the key results of the investigation comparing flexitarians with vegetarians and vegans. So for dietary motivation among distance runners, among these health-conscious athletes, what we could see is among the top 10 motives for why they should follow their diet, we only found one difference, and that was for sports performance, where the vegans were the most motivated to follow their diet type for sports reasons. Now, for BMI, we found that the flexitarians actually had the highest BMI among the groups, with a significant difference across the diet types. Now, considering these people are very health conscious, they had gone through a dietary change over their life. And so 85% of the total sample had changed their diet since childhood. Now, the difficulty of that change was overwhelmingly easy among the reports, and that it had a positive effect on physical and mental well-being in virtually all of the reports. And this may be why. It might have something to do with what they were eating. So on the right side here, we can see a forest plot. And these are the different food groups comparing the 3 diet types. So there are 3 major results here in this forest plot with significant differences across the groups. One of them is for legumes, nuts, and pulses, where the vegans were eating the most amount. Same thing with fruits and vegetables. The vegans were eating the most amount. And for protein, the vegans were actually eating the most amount of protein as well. Now here on the left side, we have another very interesting result. This is comparing diet versus training for changes in body weight. And what we can see here from the gray is that the gray means a stabilizing of body weight, whereas the dark purple means body weight went down from this factor. So we could see that diet was the primary factor for changes in body weight. So for this, I think I'll have to go ahead due to time, but we'll move on to the discussion. So what about protein? What is protein exactly? It's a macronutrient that's essential for the body to grow and sustain life. It's about 1/1,000,000th the size of a grain of salt. But where does all protein originally come from? Does anybody know? Where does all protein come from? Plants. All protein comes from plants, and any protein found in animal tissues is just recycled plant protein. So there's estimated between anywhere 10,000 to several billion different types of proteins. And in order for the body to produce these proteins, it needs to have all of the amino acids. Now, this is a very confusing topic, especially among experts in nutrition. And we use different terms to refer to proteins that have all of the essential amino acids. So high quality protein is very misleading. High quality protein has nothing to do with the end product of what the protein will become as part of the muscle tissue. It just has to do with containing all of the essential amino acids, and it comes dominantly from animal sources like meat, cow's milk, eggs. But there are some plant foods with high quality protein sources. So we can see that low quality protein sources come only from plant foods. But once again, the name has nothing to do with the functional quality of what it will eventually become as part of the body. So the RDA for protein is 0.8 grams per kilogram of body weight. So this would be something like 46 grams per day for the average woman. And considering men are a bit bigger, that's about 56 grams per day. Now, if we were going to just eat one food all day long, one specific plant food, let's choose my favorite, broccoli. So if we just ate broccoli all day long, we got our 2,000 calories, we would get a whopping 146 grams of pure protein. Now the problem there is that we might be missing out on certain levels of the essential amino acids. But there's a very easy solution to this. It's to eat a variety of plant foods in a day and not to just eat one type, which I don't recommend. So here we can see the solution to low quality protein, and it's to combine a legume with a whole grain. You can do this in a meal, or you can do it throughout a day, and the body will get all its complete proteins that it needs. But what about athletes? They need to get more protein, right? Well, athletes just need to get more calories in general. They don't need to get proportionally more calories from protein. So around 10 to 13% of daily calories from protein is perfect for adults as well as athletes. So here are typical meals that are eaten among the most health-conscious populations. These are different types of whole food, plant-based vegan meals. These meals are loaded with antioxidants, with phytochemicals, with complex carbohydrates like fiber and starch, which is why they've probably been shown to be so potent for medical treatment and have been used as a form of treatment for cancer, for diabetes, for heart disease, for the world's leading killers. Here we can see possibly why the flexitarians had the highest BMI among the groups. And that has something to do with the caloric density of foods. And so foods like meat, cheese, oil, they contain the majority of calories from fat, which has 9 kilocalories per gram. Whereas on the right side, we have strictly vegan foods. And these foods are made up of predominantly complex carbohydrates that lead to a long duration of continuous energy supply, which helps for satiety and also giving a lean physique. So the Eat Lancet Commission came out with this planetary healthy diet with the question, can we feed a future population of 10 billion people a healthy diet within planetary boundaries? They said, yeah, we can, but we drastically need to change our dietary behaviors. And so they said up to 1/3 of protein calories could come from animal products, but the other 2/3 must come from plant products, plant foods. But we also know from the Physicians Committee for Responsible Medicine that all the protein, all the calories could come from plant-based foods. And here we can see, again, the grain and the legume to get that complete protein. And this is what that actually looks like with foods on the plate. So lastly, we have the conclusion. So for vegan, vegetarian diets among athletes, we could see that vegans report sports performance as a top motivation. There was no difference in the race state dietary strategies among the groups, and that the vegan diets, the participants eating vegan diets showed basically the most fundamentally healthy dietary behaviors for fruits and vegetables, legumes, nuts and pulses, and protein intake. So tomorrow my colleague will have another presentation on results of the college and university study. And if you're interested in reading more about the vegan diet in sports, check out my supervisor's narrative review. If you're interested in seeing these results, check out our upcoming publication. So the takeaway message that plants have protein. Thank you so much.
Thank you very much. Další? Are there any questions?
I am not a vegan, but I do eat a whole food plant-based vegan diet. Thank you.
Thank you. So, thank you,
Thanks.
Mr. Tanos, for your presentation. Thank you. And now, let me welcome our next guest, Dr. Remzi Sisi from Turkey. Hello, doctor. Welcome. So, here's your microphone, and you can use these arrows to switch. I can, if you, yes, okay.
Hello, everybody. Firstly, I little speak English, so that I am sorry. I am research title the effect of blindness and depression levels on pain in geriatric prostate cancer patient. It's known that prostate cancer occurs due to the abnormal course of some cells that make up the prostate tissue, forming tumor structures. The World Health Organization International Cancer Agents reports that the annual incidence of prostate cancer in men aged 60 and 74 in Turkey is 18% in 2023. These data show that the risk of prostate cancer in geriatric male patients is relatively high. Prostate cancer is the leading cause of cancer-related death in the man after lung cancer. Global cancer observation data show that prostate cancer is in the first cancer type among all of the cancer in the Czech Republic. The literature has reported that depression is a common condition in the prostate cancer patient, and depression is observed in approximately 1 in 6 patients. Patients' psychosocial problems such as guilt, regret, fear of pain, and fear of cancer, and physiological problems such as fatigue, insomnia, loss of appetite, weight and sexual activity loss, urinary incontinence, and pain in case of metastasis can be seen. There are studies in the literature in the severity of pain, depression, and blindness levels on prostate cancer. Change, please. Change, please. Evet, change. Aim'e kadar. For aim change. Could you change, please? Could you change, please? What is aim? This study was conducted to determine the effect of loneliness and depression levels on pain in geriatric prostate cancer patients. The descriptive and correlation study was conducted in May 2023. Methods: the minimum sample size was calculated with the sampling formula. Use is in cases where the population's number of individuals was unknown. The study was completed with 83 individuals. The data of the study were collected with online questionnaire. In the questionnaire form, socio-demographic characteristic of the participants, the loneliness scale for the elderly, back depression in the inventory, numerical rating scala. Statistical analysis. The data of the study were evaluated with the SPSS 21 program. In the analysis, the confirming of the date to the normal distribution was determined by Kolmogorov, Smirnov, and Shapiro-Weiss normality test, K-square, and Fisher-exact Spearman correlation. I am sorry if there was a mistake. I don't make multiple logistic regression. Before starting the study, ethical approval was obtained from the non-interventional ethics committee of Hittit University. Table 1 was determined that the median age of the individuals included on the study was 66. Change, please. And the median pain duration of this patient was 2 years, and 90% of them used painkillers. Table 3. Table 3 was determined. The median loneliness score of the patient was 16, and 70% had depression. And table 4, socio-demographic characteristics don't show significant difference according to the severity of pain. Correlation, correlation analyzes the severity of pain has significant positive relationship with prostate diagnosis, loneliness levels, and depression levels. What is conclusion? In line with the findings of our study, pain severity, loneliness, and depression levels were high in geriatric prostate cancer patients. The relationship between pain severity and duration of diagnosis, loneliness, and depression level is significant. Developing interventions for patients' mental studies in rehabilitation studies may help elevated the severity of pain. I am sorry. Kötü İngilizce için ne olabilir? Bad English. Thank you.
Thank you very much. Do we have any questions from the audience?
Thank you.
Thank you very much. And our next guest is Nur Pinar Ayaz, yes, also from Turkey. Welcome. Yeah.
Thank you so much.
Change the slides.
Okay. Okay. Hi everyone, my name is Nur Pinar Ayaz and I'm also a lecturer in Hittit University. This study presentation will prepare it with my colleagues. And my topic is pain beliefs of nursing students and related factors. What is the research significance? You know, the pain is which is one of the oldest and most complex health problems. Pain is a condition that people are exposed to more or less different reasons in every period of life, and pain adversely affects the patient's functioning and quality of life. Minimizing pain as soon as possible with pharmacological, non-pharmacological, and complementary therapies is one of the main goals of healthcare professionals. When pain is not well controlled, it may cause various physiological and psychological effects on the patient, as well as increase the risk of acute pain turning into chronic pain. In addition, inadequate postoperative pain control increases the cost of healthcare by delaying the hospital discharge time and prolonging the healing process. Although there are many factors that affect pain control and approach to pain, it is known that one of the most important of them has pain beliefs. Nurses have various responsibilities in questioning pain beliefs about how the patient identifies pain, evaluating how these beliefs affect ways of the coping with pain, and determine the appropriate method of coping. In addition, nurses who play a key role in the team and future nurses, students, nurses' own beliefs are as important as the beliefs of the patients in pain management. What is our research aim? This research was conducted to determine the beliefs of nursing students about the organic and psychological nature of pain and the methods they use to cope with pain. When we are looking at the methods part, this study design is descriptive study, and sample size consists of the 351 nursing students, and we collected the data in the State University between February and April 2023. And we have some inclusion and exclusion criteria. The inclusion criteria, age 18 and over, they have to speak Turkish, and they don't have any communication problems, and the voluntary agreed to participate in the study were included in this study. Data collection process, firstly we obtained the institutional review board of the university, and we used the two different questionnaire. One of is socio-demographic questionnaire, and other is the pain belief scale. The data were collected during the course hours of the students in the nursing department of a state university, Faculty of Health Science. The purpose of the research, inclusion criteria, the question were explained, the students, informed consent was given, those wanted to participate, their signatures were taken, and questions were given to the students. It took about 50 minutes for the students to fill out the questionnaires. To ensure confidentiality, participants were assigned a code number and to all study materials. Data analysis, we use the SPSS program, and we use percentage, median, Kruskal-Wallis, man-Whitney test, and Superman correlation analysis. In the result parts, our participants, most of them are women. Most of participants are second-year students, and their age is 20 years. And most of participants live in the government dormitories, and a high percentage of the students say that they did not have any chronic disease. And the median scores of the students in the pain belief scale were found to be 3.50 in the organic subdimensions and 2.25 in the psychological subdimensions. In the pain experiences, most of students suffered from pain once a month, and the pain parts are head and neck pain. 70% of the students experience moderate pain, and generally the pain cause is fatigue, stress, and menstruation. 30% 31.9% of the students preferred to use pharmacological and non-pharmacological methods together. And when we are looking for distribution of the scores obtained from the pain belief scale according to the demographic characteristic and pain experiences of the participants, organic pain belief was found to be significantly higher in 4th grade students compared to others. Physiological pain belief is the highest among students staying in private dormitories. Organic pain belief was significantly higher in those who described their pain as severe, very severe, unbearable. Organic pain belief is higher in those who use pharmacological and non-pharmacological methods together to relieve pain. Correlation of variables associated with students' organic pain beliefs. A positive significant relationship was found between psychological pain belief and organic pain belief. A significant positive correlation was found between the ages of the students and their organic pain beliefs. A significant positive correlation was found between students' grade level and organic pain beliefs. In the discussion part, generally we have the same result with the literature. In the limitation, the data is collected only at certain time intervals during the course hours. Some students do not want to participate in the study. The failure to collect data from students who are absent from classes. The first-year nursing students have less knowledge about pain-related coping methods than other classes. And the conclusion and recommendation parts. The organic pain belief of the students was higher than the psychological pain belief. In addition, it was determined that students with high organic pain levels used non-pharmacological and pharmacological methods together to cope with pain, and their age and class level were higher. It is recommended to make the subject of pain more comprehensive in undergrad education in order for students to learn pain beliefs and current pain coping strategies throughout their education process. In addition, it is another suggestion to determine the psychological factors affect pain beliefs and pain management by conducting more studies on the subject. It should be aimed to increase the awareness of students who are health professionals of feature about pain beliefs and thus to provide more effective pain management. These are references, and thank you for your patience.
This is Ayaz. Do we have any questions from the audience? Yes, of course.
So the study was conducted only in one university?
Yeah, right.
Only one university?
Yeah. Mm-hmm.
So the university had 3 years students of nursing?
4 years.
4 years.
Yeah.
So one of the results was there was a significant difference or correlation between the age of students and organic pain belief.
Yeah.
So who had the highest or severe pain belief in terms of the age?
The age?
Younger people or the oldest?
Younger people, yeah.
Okay, why do you think there was a strong belief about the pain among young people compared with the older students?
I'm not sure.
Okay. So another question is, because you measured the belief, yes or not?
Yes, right.
So why you didn't do qualitative study instead of quantitative? Because the tests you use, such as Kruskal-Wallis and Mann-Vietney, yes or not, they are actually showing no parametric test. Means your sample size was low, 358, because you did no parametric test. Why you didn't do qualitative
The
research?
problem is in the Turkey, generally, they don't want to, the easiest to data collection and for publication. So we generally prefer to quantitative.
Yeah, one of the objectives of your study was to identify the coping strategies of students, yes or not? So what was the result for that? What is the most coping strategies among the students?
I don't understand your question. Could you say again?
One of your objectives was coping strategies. How can get rid of the pain? Yes or not? This is coping strategies you mentioned in your objectives. So I want to say, what was the most common coping strategies among the students?
Generally, they use the painkillers. Most of them.
Pain relief.
Yeah.
Okay.
Yeah, massage also.
Okay. Thank you so much, Doctor. Well done.
You're welcome. Thank you so much.
Yes. It's a question a little bit. Okay. Why or would you think to use some natural medicines in your studies? Why, for example, only the painkillers, the chemical painkillers?
Yeah, generally they prefer to painkillers. It's most of use them because they want to. It's the easy results. Yeah.
Okay. So, are you open to this direction? This is a question because I wanted to do it for you also. Are you open?
All of the health science students, and they didn't use commonly alternative therapies.
Okay. Okay. Thank you.
That is a good conclusion based on her information that you can promote the knowledge of the students to use. Yes, non-pharmacological treatment, yes or not?
Yeah.
And using herbal or actually these types of pain reliefs. Yeah, that's very good. Or even you can develop proposal for future research to identify how can promote their knowledge by using different interventional approach.
This is a good advice. Thank you so much. Yeah.
Actually, I have a proposal for you. I have a proposal for both of you.
Yeah.
Since we are neighbors, also I'm from Greece. Okay, I'm naturopath. I was thinking about the flower essences that I have much experience, and it's very helpful for psychological issues we have, and it helps very much. After all, like indirect way, the pain. So I really would like to talk to you about how also in the older people that they have cataract, then they have depression and all this that can help. Okay.
Yeah. Okay. Thank you so much. We will have it.
Thank you. So unless there are any more questions or topics, I would like to thank you very much for your presentation. Thank you. And I will say goodbye to you all. I thank you for joining us, whether it's here in person or those who are watching us virtually. And I hope to, of course, thank you again to our wonderful guests. Thank you. And I hope to see you here again tomorrow when we begin at 9:15 in the morning. Thank you very much and goodbye.